What is up, ladies and gentlemen? Today is Wednesday. Hey, y'all got me to 100,000 likes yesterday, so y'all already know the deal. I told y'all I was going to be here. I told y'all I was going to be here for y'all. We're going to do another set of questions today, and we're going to get it on and popping. Today is Wednesday. This is probably the most I think I've done lives all at once. So welcome. If you guys are new here, welcome. We are about to do NCLEX questions. Probably going to be about an hour, getting some good knowledge in, you know what I'm saying? About an hour. So if you guys are new here, welcome. We're going to do NCLEX questions. Make sure you guys smash that like button. You guys follow as well as you guys share because you're not greedy. You know what I'm saying? Y'all aren't greedy out here. So we're going to be doing NCLEX questions. Once we get 100 people into this live, I'm going to turn this camera around. Heather says, happy early gobble gobble day. Heather, girl, first of all, I love you, girl. I love you. I appreciate you. Happy early Thanksgiving to you, ma'am. Happy early Thanksgiving. And happy early Thanksgiving to everybody. Obviously, we won't be doing a live stream tomorrow because I obviously got a family. I can't be here teaching y'all. You know what I'm saying? So, hey, if you guys are new here, welcome. We're going to do NCLEX questions. But also, I want to know who you are, where you're from, where you're at in your nursing journey, right? If you're not a nurse, I want to know what you're doing here, trying to get you some nursing knowledge, and ain't nothing wrong with that. And then I need for y'all to smash that like button. I need for y'all to share, and I need for y'all to follow. That's what I need. What questions do you guys have before we get this thing rocking? Also, I'm going to be talking about the NCLEX course, y'all, my 7-day NCLEX course. The price is going up to $97 on Friday. So, we'll talk about that a little bit later. I'll show you guys what the course looks like. But hey, priority number one is to get these questions out. So we are about to do NCLEX questions. Somebody said a no-no. And TikTok looked like it blocked it. So if you said a bad word, TikTok blocked you. You know what I'm saying? So welcome. We're going to do NCLEX questions. Once we get 100 people in here, I'll turn this camera around. We'll get it on and popping. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Hey, I had 101,000 likes yesterday, y'all. That's the most likes I've ever gotten. What's up, Lil Hoover? Larry Hoover. I see you, girl. I see you. Hey, so you already know the deal. We got 100,000. We got 100 people up in here. We turn this thing around and we'll get this thing rolling. All right. I think everybody can see that. Hey, if you can see that, let me know. You should be able to see that. Let me bring this down. Hey, so real quick, a little bit of housekeeping, right? We're going to be doing NCLEX questions, okay? Make sure you guys participate. Hey, some of these questions are long, y'all, so I'm probably going to get winded, but that's okay. Y'all got to bear with me. Hey, participation is the key. Y'all got to like, share, and follow. Smash that like button. I need at least 10,000 likes. Make it happen. 10,000 likes. Hey, don't be selfish your whole life. Make sure you guys share and follow, okay? Hey, don't come to my chat or be a fool or act a fool because I will ban you. Trust me, I'm petty and I thoroughly enjoy it. Alicia says recovering from a cervical replacement. Thanks for giving me something educational. I got you, Alicia. I got you. Also, I got these questions off nurseslabs.com. You guys can go over there and check those out. They're free sets of questions. Okay. 7-day NCLEX course. Get it for a lifetime for $48 right now. On Friday, it's going to $97. So go over there and get it. There's a new generation NCLEX review inside of there. We'll talk about that later. Also, if you need one-on-one coaching, I do that as well. Both those links are in the bio. And we're going to do an Ask Me Anything to follow this. Okay. So here we go, y'all. Question number 1. During a community health assessment at a local school's parent-teacher conference, the nurse encounters several parents and caregivers. Based on their shared histories and lifestyles, the nurse determines the risk factors for hypertension among them. Which of the following individuals is at the highest risk for developing hypertension? Is it a 45-year-old African-American attorney with a family history of hypertension who has a sedentary lifestyle, consumes a diet high in sodium, and recently had a significant weight change? A 60-year-old Asian-American shop owner with a BMI of 28 who has a well-managed type 2 diabetes, takes medication for high cholesterol, and engages in regular physical activity? A 40-year-old Caucasian nurse who is a vegetarian with a healthy BMI, is a non-smoker but reports high levels of work-related stress and consumes excessive amounts of caffeine. Just like every nurse, right? A 55-year-old Hispanic teacher who smokes occasionally, has a healthy BMI, participates in moderately intensity exercise program, and recently started taking oral contraceptives. A 50-year-old Middle Eastern engineer with a BMI of 26 who has a family history of cardiovascular disease, does not engage in any form of exercise, and has recently been diagnosed with obstructive sleep apnea. a 52-year-old Native American artist with a family history of kidney disease who smokes a pack of cigarettes daily, drinks alcohol excessively, and reports infrequent physical activity, or a 43-year-old European baker who has a BMI of 30, often deals with job-related stress, consumes a diet rich in pastries and sweets, and has a sedentary lifestyle due to long work hours. What are we thinking? Sorry, I know that was real long-winded, y'all. What are we thinking? What are we thinking? We got some G's. We got some A's. Meg, you said G. Oh, now you're saying A. Okay. What else are we thinking? Hey, what's going on, everybody? We're doing NCLEX questions. This is a long one. I'm going to give you guys some time. As a matter of fact, let me start the timer right now. I'll give you guys, we'll say 30 seconds, probably less than that. Everybody's screaming A at me. Okay. Awesome. Hey, if you guys are new here, welcome. We're doing NCLEX questions. This is a long question. I got real winded. So no, you're not late. We just started. All right, we got we got some people, but G is a good one too. G is a good one. It's a good one, right? So think about those it has a high risk for developing hypertension. What are the key factors of developing hypertension, right? All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and I messed up. My bad. Here we go. And the answer, of course, is A. African American adults have a higher prevalence of hypertension compared to other racial and ethnic groups in the United States. This individual also has a family history of hypertension, a sedentary lifestyle, and a diet high in sodium, which are all factors for hypertension. Therefore, this individual is at the highest or greatest risk for developing hypertension among the given choices. Okay. Hey, that is reduction of risk potential. Okay. Reduction of risk potential. All right. So when you guys are reading, of course, read your rationales, why it's correct, and then why these are incorrect. OK, hey, some of these won't have all the rationales out. Hey, and that's just kind of how that works. OK, here we go. Question number 2. A 15-year-old female with a history of depression is brought to the emergency department. Here are your nursing notes at 11:15. A 15-year-old female with a history of depression and recent relationship troubles with her close friends is brought to the emergency department by her concerned parents after they found an empty bottle of maximum strength acetaminophen in her room. Upon questioning, the patient tearfully admits to ingesting 15 tablets of the medication 45 minutes ago. She is visibly anxious and frequently looks at the marks on her wrists, which seem to be superficial scratches. Her vital signs are as follows: blood pressure 120/70, heart rate 88, respiratory rate 18, O2 sat 98 on room air. As the nurse prepares to address the situation, several orders from the primary care provider come in. Which of the following orders should the nurse prioritize and carry out first? So what should I do first? You can't see the upper left. Let me back it up some. Let me see if that makes it better. There we go. All right. Do we want to perform the gastric lavage, right? Do we want to administer, the mucomist orally? Do we want to start an IV of dextrose 5% and 0.3% of normal saline? Have her drink activated charcoal? Conduct a psychiatric evaluation, or wrap wrist restraints to prevent further self-harm? It's either D or E. Okay. You got to give me one. Hey, if you guys are new here, welcome. Make sure you guys smash that like button. Hey, today's day 3. All right. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. That's important. Yesterday, y'all, we had 100,000 likes up in here, y'all. 100,000 likes. Okay. So what is the very first thing that I want to carry out? Remember, she just ingested 15 tablets of Tylenol. Okay. So what is the very first thing that I want to do? Okay. What are we thinking? Make sure you guys like, share, and follow. Got these questions off nurseslabs.com, okay? Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. You want to administer that mucomist orally. Although gastric lavage can help remove any remaining acetaminophen from the stomach, it is not the priority intervention in this situation. Administering the antidote, which is the mucomist, should be the primary focus to counteract the toxic effect of the acetaminophen on the liver. The mucomist is the antidote for Tylenol or acetaminophen toxicity and should be administered as soon as possible to maximize its effectiveness in preventing liver damage. That is part of physiological adaptation, which is the second largest section on the NCLEX. Okay, second largest section. This is why it's important that you know your content. You also know your Q&A. You do your Q&A and you go through your rationales. Okay. Here we go. Question number 3. Like I told y'all, some of these are long. A 68-year-old male with a history of hypertension and diabetes has undergone a cardiac catheterization to evaluate potential coronary artery disease. He has a known allergy to iodine-based contrast agents, which require pre-medication with corticosteroids and antihistamines. The procedure was successful, but the patient experienced brief hypotension during the administration of the contrast material. The patient has been transferred to the cardiac step-down unit for observation, and the nurse is aware of the potential complications that can arise in the initial 24 hours post-procedure. Which complications should the nurse monitor closely during this period? Is it persistent angina despite being at rest and receiving nitroglycerin? Is it thrombus formation leading to decreased peripheral perfusion and cyanosis? Dizziness accompanied by a sudden drop in blood pressure when standing? Or is it gradual decrease in blood pressure with no other symptoms? What are we thinking? Megan, girl, I see you. I see you out here. Appreciate the rose. Thank you for the heart. Hey, we're on question number 3. We got some long-winded ones here. Hey, if you guys are new here, welcome. I need for you guys to smash that like button. I need for you guys to share. I need for you guys to follow because you're not greedy. You know what I'm saying? Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. I'll give y'all 10 more seconds. Also, I got these questions off nurseslabs.com. If you guys are interested, you guys can go over to that website and check those out for yourself. Chrissy says B. Okay. Smash that like button, y'all. We need 10,000 likes. We need 10,000 likes. Let's make it happen. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B, thrombus formation. In the initial 24 hours after a cardiac catheterization, the nurse should closely monitor for thrombus formation. Thrombus formation at the catheterization site can lead to serious complications, such as decreased blood flow to the extremities or embolization to other parts of the body. While the other options can be potential concerns, thrombus formation is the most critical complication to monitor for during the immediate post-procedure period. That is part of management of care, the largest section on the NCLEX exam at 18 to 23%. Okay, it is the largest section. All right, so be aware of that. All right, here we go. Question number 4. A 43-year-old male with a history of recurrent renal calculi, which are kidney stones, is admitted to the emergency department presenting with severe left flank pain radiating to the groin, nausea, and an episode of vomiting. He also reports burning and urgency during urination. His vital signs reveal a temperature of 100.8, blood pressure 145/90, a pulse of 100, and a respiratory rate of 20. The client is visibly anxious and uncomfortable due to the severity of the pain. The nurse is assigned to care for the client, or the patient, and must prioritize the nursing goals to ensure optimal care. Which nursing goal should be the top priority for this client? Is it maintain fluid and electrolytes, control nausea, manage pain, or prevent UTIs? What are we thinking? Shout out to all 141 of y'all. Got these questions off nurseslabs.com. Make sure you guys smash that like button. We need 10,000 likes. Y'all being kind of greedy over there. Hey, get carpal tunnel for me. Make it happen. We got A. We got people screaming C. Okay, got some A's. We got some C's. Okay. Danielle, thank you for the follow. Appreciate you. What else? Is it Sandu says A, Megan says C. Megan's screaming C at me. It's kind of rude, but whatever. Denise, thank you for the follow. User62, appreciate the follow. A, due to an elevated temperature. Okay. All right. Here we go, y'all. Here's our answer. In 3, 2. And the answer is C. It is pain management. Okay. Managing pain is always a priority because it ultimately improves the quality of life. The cornerstone of the ureteral colic management is analgesia, which can be made expeditiously with parenteral narcotics or non-steroidal anti-inflammatory drugs. So NSAIDs, right? So when somebody has kidney stones, the number one thing to help alleviate that is pain management. Okay, that's part of basic care and comfort. All right, one of the smaller sections, 6 to 12, but still very important, okay? This is something that you guys learn when you're in fundamentals or in foundations, you know what I mean? All right, here we go. Question number 5. During a school screening program for children ages 6 to 12, a nurse is tasked with evaluating their growth parameters. She encounters a 9-year-old who is shorter than her peers and seems to have less muscle development. To align her observation with typical growth expectations for school-age children, what would the nurse expect to see? Is it A, decreasing amounts of body fat and muscle mass, little change in body appearance from year to year, progressive height increase of 4 inches each year, or yearly weight gain of about 5.5 pounds per year? What are we thinking? Hey, shout out to all 200 of y'all. Shout out to all 200 of y'all. We are striving for 10,000 likes. I got these questions off nurseslabs.com. We're doing NCLEX questions. Make sure you guys go over there and check that out. Like, share, follow. Don't be greedy your whole life. You know what I'm saying? Get carpal tunnel for me. Get it. All right. And then just after that, start stomping at it with your toe or something. You know, make it happen. Also, I want to know who you are, where you're from, where you're at in your nursing journey. I'll give you guys 10 more seconds. 10 more seconds. What are we thinking? Abby says A. Lil Hoover says C. Jasmine says D. Okay. All right. Cooper says C. All right. All right. Shout out to y'all. Hey, the participation is everything that goes on here. You got to participate. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And that is not the answer. Oh, man. Hold on one second. Hold on. I don't know what I did with it. Oh, here it is. Found it. There it is. It's D. I was like, what happened there? And the answer is D, y'all. It is yearly weight of about 5.5 pounds per year. Okay. A school age children gain about 5.5 pounds each year and increase about 2 inches in height. Between ages 2 and 10, a child will grow at a steady pace. 3 for 3. Megan, shout out to you being 3 for 3. Appreciate the follows. All right. And that is part of health promotion and maintenance. Okay. 9 to 12% on the NCLEX, okay? 9 to 12%. And of course, here we go. Commercial break. Don't y'all go nowhere real quick. Hey, you guys got to participate. Smash that like button. We're getting to 10,000 likes, all right? Make sure you guys share. Make sure you guys follow. Give me all them likes. Don't be selfish your whole life. Share this to people who you feel may need it. If you're in school, share it to your cohort, all right? Hey, if you come into my chat and you be rude, I'm going to ban you. I'm going to ban that ass. Literally, it says it. I'm going to ban that ass. All right, so don't be rude. Nurseslabs.com is where I got these questions from. Also, 7-day NCLEX course, and if you need one-on-one tutoring, those links are in my bio. 7-day NCLEX course is for $48. That price is going up on Friday, so go over there and get it. Also, we're going to do an Ask Me Anything after that. So, Mama said, hey, Kev. Hey, what's up? Megan's mom, what's up? Hey, here we go. Question number 6. A 62-year-old client arrives at the community health fair where the nurse is offering blood pressure screening. Upon assessment, the nurse notes that the client's blood pressure is 160/96. The client claims that their blood pressure is usually much lower, and they recently started new medication for arthritis. What would the nurse advise the client to do? Is it A, get a blood pressure check within the next 15 minutes, check blood pressure again in 2 months, see the healthcare provider immediately, or visit the healthcare provider within 1 week for a blood pressure check? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Make sure you guys smash that like button. Get us to 10,000 likes. Make sure you guys share because you're not greedy. And make sure you follow because, I'm kind of cool sometimes. Whatever. And also, I want to know who you are, where you're from, and where you are at in your nursing journey. Let me give you guys 15 seconds. A, recheck blood pressure. Okay. Queen Tanya, I see you in there, says A. Okay. Emma says C. All right, cool. All right, y'all. Here we go. Here's our answer, y'all. Here is our answer. Answer is coming. Jessica, appreciate the follow. Thank you. Here we go in 3, 2. And the answer is A. Get a blood pressure check within the next 15 minutes, right? The blood pressure reading is moderately high with the need to have it rechecked after a few minutes to verify. The client states it is usually much lower, thus a concern exists for complications such as a stroke. That is part of health promotions and maintenance. Usually that's what happens. If you normally have a lower blood pressure, hey, give it 15 minutes, let them sit down, let them relax, and then check it again. 9 times out of 10, it's going to go down. If it stays up or if it goes higher, that's a different thing, a different voice for concern, okay? Shout out to you, Nee or Nay, Whip, Nay, girl, I hear you. I see you out there. Appreciate all the follows. Here we go, y'all. Question number 7. It's a busy evening shift and the hospital has just sounded an alarm for a disaster drill. The unit manager informs the nurse that they need to make room for potential mass casualty admission. This is a very real scenario, by the way. A nurse is given 4 clients and must decide who to prioritize for discharge to accommodate new admissions. Who should the nurse consider first to discharge? AKA, who is the most stable for me to get rid of? And that's probably bad for me to say, but who's the most stable for me to send home? Is it a middle-aged client with a history of being ventilator dependent for over 7 years and admitted with bacterial pneumonia for 5 days ago? A young adult with diabetes type 2 over 10 years and admitted for antibiotic-induced diarrhea 24 hours ago. An elderly client with a history of hypertension, hypercholesterolemia, and lupus and was admitted with Stevens-Johnson syndrome this morning. Or an adolescent with a positive HIV test and admitted for acute cellulitis of the lower leg 48 hours ago. What are we thinking? I wanted to find some tougher questions for y'all. I think these are pretty good. Hey, if you guys are finding value out of this, make sure you guys smash that like button. We need 10,000 likes. Make sure you guys share and make sure you guys follow. Also, y'all need to tell me who you are, where you're from, where you're at in your nursing journey. I think, is it Nay or Nee? She's the only one. She's the only one that told me that she was a nurse. Hey, a little bit about me, by the way. I've been a nurse for 3.5 years. I also have been in the Navy for 16 years. I've worked ICU, I've worked OR, and I've worked PACU. I have a 8-year education background in the Navy from teaching in some programs. So just a little bit about me. Also, I failed my NCLEX 3 times, y'all. Yep, I said it. I failed it 3 times. 3 times. And I'm still a nurse, still out here doing my teaching thing. And I still love teaching. I still love telling people about it because y'all can fucking overcome, baby. That's how we do it. All right, here we go. Here's our answer. In 3, 2, shout out to Columbia and Maryland. Okay. And the answer is A middle-aged client with a history of being ventilator dependent for over 7 years and admitted with bacteria pneumonia 5 days ago. The best candidate for discharge is the one with a chronic condition and is most familiar with their care. The client in option A is most likely stable and could continue medication therapy at home. All right. Pick you, nurse. Going back to where? All right. So, hey, that's part of safety and infection control. Okay. Hey, the key word in that answer was 5 days ago. They were admitted for bacteria pneumonia, but that was 5 days ago. They shouldn't have bacteria pneumonia by the 5th day. If they do, that's a different story, but they didn't give you that in the question. Okay. You go off of face value of what they give you, use your critical thinking, and then make a clinical judgment. Okay. That is what the NCLEX wants, and that's what you have to do. All right. Here we go. Question number 8. They can do that at outpatient med. Sure can. Here we go. Question number 8. A 25-year-old male is seen in the endocrinology clinic for unexplained fatigue, weight gain, and low energy levels. After a series of diagnostic tests, he is diagnosed with hypothyroidism. The healthcare provider prescribes Synthroid or levothyroxine 50 micrograms per day by mouth. As the nurse educates the client about this medication, which point should be emphasized? So what is the most important thing that we need to tell this patient in regards to this medication? When it comes to safety, should be taken in the morning, may decrease the client's energy level, must be stored in a dark container, will decrease the client's heart rate. What are we thinking? What are we thinking, y'all? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys go over there, check those out for yourself. They're free sets of questions. Free, baby, free. I already know how y'all feel about free. You know what I'm saying? So go over there and check those out. Also, smash that like button. Make sure you guys share. Make sure you guys follow. Okay? They're all right. Hey, I said free. I didn't say if they were great. I didn't say if they were bad. I'm just saying that they're free. So, hey, 10 seconds, y'all. 10 seconds. Also, make sure you guys, hey, let me know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, cool. What you doing here and what you do as a profession. We at the 10,000 likes, baby. We at 10,000 likes. I appreciate y'all. Here we go, y'all. Here's our answer in 3, 2. Oh, I got you. No, the answers are all right. Oh, I got you. The answers are all. I see what you did there. All right, y'all. Here we go. Here's our answer in 3, 2. Shout out to Ontario, Canada. And the answer is A. It should be taken in the morning. right? Synthroid has a side effect of insomnia. Taking it in the morning could prevent interfering with the client's sleep pattern, right? That's part of pharmacological and parenteral therapies. That is the second largest section on the NCLEX. Hey, the top three: management of care or coordinated care, pharmacology, and physiological adaptation. Those are the three largest sections on the NCLEX, making almost half of the NCLEX, okay? Keyword is should. You are correct. All right, med student, I love learning from y'all. Is it Audrey? Shout out to you, Audrey, for being up in here. Appreciate you. Here we go. Question number 9. A 3-year-old child was brought to the pediatric clinic after sudden onset of findings that indicate or that include irritability, thick, muffled voice, and croaking on inspiration, hot to touch, sit, leaning forward, tongue protruding, drooling, and suprasternal retraction. What should the nurse do first? Prepare the child for x-ray of upper airway, examine the child's throat, collect a sputum sample, or notify the provider of the child's status, right? I mean, that question literally just gave you, all your signs and symptoms are there based off of an assessment. So if all the information is given to you, what will be the next thing? What would be the next thing? What? Think about it. Hey, RTFQ. Hey, if you know what RTFQ means, I need for you to drop it in the chat. Making screaming epiglottitis at me. Okay, cool. If that's what we think, it is, what would be the next step in that process? Read the question, ladies and gentlemen. Read the question, okay? What is RTFU? No, it's RTFQ. And RTFQ means read the fucking question. And I say that out of love. I don't say that out of aggression. But that's what it means. RTFQ, read the question. Okay, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is to notify the healthcare provider of the child's status. These findings suggest a medical emergency and may be due to epiglottitis. Any child with an acute onset of inflammatory response in the mouth and throat should receive immediate care. That is a physiological adaptation. Remember, that whole question gave you everything. It gave you your entire assessment. It gave you your signs. It gave you your symptoms. Next thing you know, okay, now I know it's an airway issue. Hey, doctor, help. Somebody help. That's what you better be doing, okay? That's what it's a medical emergency at that point. You better be screaming for help, all right? You better be screaming for help. Here we go. Question number 10. Hey, this is a long one, all right? A school nurse is assessing 8-year-old Timmy. Why does everybody's example need to be Timmy? But whatever. Who was brought to the school health office by his teacher due to concern of his recent behavior. The teacher reports that Timmy has been asking to go to the bathroom frequently during class, appears tired, and has been caught sneaking snacks during lessons. Upon further questioning, Timmy's mother, who was called to the school, mentioned that he has been drinking more water than usual at home, has an increased appetite, and has had few episodes of bedwetting in the past month. She also notes that despite eating more, he seems to have lost some weight. Given these observations and suspecting diabetes, which symptom is most likely to prompt parents to seek medical evaluation for this school-age child? Is it polyphagia? Is it dehydration, bedwetting, weight loss, or is it frequent urination during the day? What are we looking for? What are we looking for? Shout out to everybody that's in here. Hey, we need to get to 20,000 likes. 20,000 likes. Let's make it happen, all right? Smash that like button. Make sure you guys share. Make sure you guys follow, okay? Also, got these questions off nurseslabs.com. Nurseslabs.com. They are free sets of questions. They're all right. No, but free sets of questions. The questions are pretty good. These are pretty lengthy, okay? Make sure you guys go over there and check those out for yourself, all right? Also, RTFQ. Read the effing question, y'all. Read what the question is asking you, all right? Here we go. Hot Cheeto Queen. Hey, I'm not even gonna lie. That's probably one of the best names I think I've seen today. So shout out to you. Somebody get Kevin some insulin. First of all, what you mean? First of all, I don't need his name is Timmy. It's not even Kevin. The disrespect. Lord of mercy. All right, here we go. Here we go, y'all. Here's our answer in 3, 2. And the answer is C. It's bedwetting. While all the symptoms listed can be indicative of diabetes mellitus, bedwetting in a school-age child who previously had control over their bladder is often the most alarming symptom for parents. It represents a regression in a previously acquired skill and can be distressing for both the child and the parent. This symptom, combined with the other signs will likely prompt parents to seek medical evaluation. That is a physiological adaptation question, 11 to 17% on the NCLEX exam. Okay, that is 11 to 17%. Remember, you need content, you need Q&A, and you need rationales. Okay, here we go. Hey, real quick, commercial break. Hey, we're doing NCLEX questions, so I need for y'all to smash that like button. Hey, we need 20,000 likes. Y'all need to make it happen. All right, share, follow, give me them likes. Don't be selfish your whole life. Share it to your cohort. Share it to whoever you think needs it. All right. That's what I'm saying. The answer was bedwetting. Hey, just like NCLEX, we don't go back. I'm just letting y'all know. Hey, you come to my chat and you act a fool, I'm going to ban that ass. Literally, it says it. I'm going to ban that ass, okay? So don't be that person, all right? Be nice. Don't be rude, all right? Nurseslabs.com is where I got these questions. Also, the 7-day NCLEX course, that is my baby. That is my NCLEX course. We'll talk about that later. $48 right now. The price is going up on Friday. I'm telling you right now. I got a new generation NCLEX course that's in there right now. I'm trying to tell you, Megan, you got to leave already? Girl, you always leaving. You better come back. You know what I'm saying? But hey, so we're going to do an Ask Me Anything at the end of this, okay? So you guys make sure you guys stick around after these questions. Here we go. Question number 11. A 29-year-old female client who is a professional dancer presents to the emergency department after a performance complaining of severe lower abdominal pain, fever, and an unusual vaginal discharge. She mentions that she has similar symptoms 2 months ago and was treated in an urgent care clinic. She also reports having multiple sexual partners in the past and inconsistent condom use. Given that the clinical presentation and her history, which of the following infections is most frequently associated with a recurrence of pelvic inflammatory disease? All right. Was it a trichomoniasis, chlamydia, staphylococcus, streptococcus, gonorrhea, or E. coli? Hey, if I said that wrong, sorry. It says horrible. I've never been so stressed in my life. What you mean, Sierra? What you mean? Shout out to everybody that's in here. Make sure you guys smash that like button. We need 20,000 likes. It's either one. It's one of them. It's not select all that apply. It's one. You got to give me one. Give me one. B or E. Okay. Hey, make a decision and run with it. Make a decision and run with it. This is why we train, so to speak. Okay, you train to where you find out the answer, and then you shouldn't get the answer wrong anymore, right? You should be very familiar with it at that point. Sierra just took the NCLEX. Oh, girl, hey, you good out there? You good? Hey, come back on Thursday or Friday. Oh, come back on Friday and tell us what you got. All right, so we can give you your praise. Morgan said, I've been a nurse for 10 years. Shout out to you. Is this select all apply? No, it doesn't say select all apply on the question. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B. It's chlamydia. All right. It's chlamydia. Pelvic inflammatory disease is an infection of the female reproductive organ. It's usually caused by a sexually transmitted infection. Chlamydia and gonorrhea are the most common causes of pelvic inflammatory disease. Among these options, chlamydia is the most frequently associated with PID. It's essential to diagnose and treat chlamydia promptly, as it can lead to serious complications if left untreated, including infertility. That is a physiological adaptation question. Notice how it said chlamydia and gonorrhea, right? But it says chlamydia is most frequently associated with PID. All right. Those are those things that you got to look out for. Graduating nursing school in 14 days. I better get some right, ma'am. You better get them right. All right. Nursing plan Daniel, I don't know what you're talking about. You had that similar question. Okay. Here we go. Question number 12. An experienced registered nurse specialized in spinal rehabilitation is floating to a busy emergency department for a shift. The emergency department is currently short-staffed. Tell me something I don't know. And there's a power outage in the adjunct building or the adjacent building, causing a surge of patients. Among the patients waiting, which client should the charge nurse most appropriately assign to this RN, keeping in mind her expertise and the current situation? Is it A, middle-aged client who says, I took too many diet pills and my heart feels like it's racing out of my chest? A young adult who says, I hear songs from heaven, I need money for beer, I quit drinking. Oh yeah, I'm sorry, I started laughing on the inside. I need money. I quit drinking 2 days ago for my family. Why are my arms and legs jerky? An adolescent who has been on pain medication, terminal cancer with an initial assessment finding pupil and reflex or relaxed respiratory rate of 11. An elderly client who reports taking a large crack hit Lord, a large crackhead 10 minutes prior to walking into the emergency department, or a pregnant woman in her third trimester complaining of sudden sharp pain in her lower abdomen. I'm sorry, y'all. Reading these are funny. It's because I've seen them. So I'm reading them and it took me back. So what are the answers, y'all? What are y'all thinking? Hey, if you guys are new here, welcome. Hey, welcome. Hey, we're doing NCLEX questions. I got them off nurseslabs.com, okay? nurseslabs.com, free sets of questions, all right? Make sure you guys go over there and check those out for yourself. Make sure you guys smash that like button, you guys share, and you guys follow. Is it Cream and Maddie? Your name is Cream. I can't believe I just said that out loud. I appreciate y'all. I appreciate the follows. A or E, Mallory, you got to give me one. I'm going to give y'all 10 seconds, okay? 10 seconds. These patients are a hot mess. Look, I'm trying to tell you. Hey, for all my ER folks, y'all already know they already know what's up. They're probably laughing because they're just like, yo, that's just a regular day. All right, y'all, here we go. Here's our answer. In 3, 2. And the answer is C. All right. An adolescent who has been on pain medications, terminal cancer with an initial assessment, finding pupils and a relaxed respiratory rate of 10. Nurses who are floated to other units should be assigned the client who has minimal anticipated immediate complications of their problems. All right. This client exhibits opioid toxicity with the pinpoint pupils and has the least risk of complication to occur in the near future. Bella, what is up? Why you scream my name like that? Oh, damn. I thought priority. So think about it. You can think, hey, it's management of care, by the way. Largest section on the NCLEX, right? Anywhere from 18 to 23%. Largest section. All right. But you got to think, I have a nurse who specializes in spinal who's getting thrown into the ER. So I need to be able to give her something that is not super complicated, right? Because they don't specialize in emergency care or trauma. All right. That's why you got to read the effing question. You got to read the question to include the answers. All right. All right. Question 13. A 60-year-old male is admitted to the cardiology ward following an angioplasty for coronary artery disease. Nutrition education is a part of his discharge planning. What dietary advice should the nurse prioritize? Is it eating 3 balanced meals a day, adding complex carbohydrates, avoiding very heavy meals, or limiting sodium to 7 grams per day? 7 grams? Why? Look, okay. Hey, I didn't make these questions, okay? But 7 grams is crazy. The fact that it says limiting is even more crazier. Saying like, hey, yo, that's cool. You could do that. 7 grams is crazy. Or like homegirl that makes fun of the Kardashians. She's just like, not the 7 grams. Oh my God. Hey, shout out to y'all. I'm gonna give y'all 15 seconds. Okay. 15 seconds. We got A. Okay. We got some C's. Okay. Got E's not even on here. Duchess. What you mean? Come on. Queen. I mean, not queen, but princess. What are you making that face for? 7 grams is basically right. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C. Avoid very heavy meals. Eating large, heavy meals can pull blood away from the heart for digestion and is dangerous for clients with coronary artery disease. Too much plaque may accumulate in the arteries and block the delivery of blood and oxygen in major organs of the body. That is part of health promotions and maintenance, 9 to 12% on the NCLEX. I finally got one right, but that's okay though. That's okay. You eventually was going to get there. Who here is an RN student? We're all students under God, you know what I'm saying? Or whoever your religious being is, you know what I'm saying? Because we equal opportunity love around here. So, but shout out to all my students. Shout out to everybody that's in here. All right. Hey, here's question number 14. Hey, this one's long. Okay. So bear with me. A 45-year-old patient in the intensive care unit who was recently involved in a severe car accident has multiple fractures and internal injuries. The patient has a history of chronic back pain and has been on long-term opioid therapy. The patient is currently on a pump set to deliver a basal rate of 10 milliliters per hour of morphine plus PRN dosage for breakthrough pain. The nurse also notes that the patient has been frequently pressing the PRN button for additional relief. Given this scenario, which observation indicates that the pump may not be functioning correctly? I'm sorry, I'm laughing again because I've seen this happen in real life. The client complains of discomfort of the IV insertion site and has slightly redness around the area. The client states, I just can't get relief from the pain, even after pressing the PRN button multiple times. The level of the drug is 100 mLs at 8 a.m. and 80 mLs at noon, despite the patient's frequent request for PRN drugs. The level of drugs is 100 mLs at 8 a.m. and is 50 mLs at noon. The patient's respiratory rate has decreased to 8 breaths per minute, or the patient's blood pressure has dropped significantly since the last reading. What are we thinking? Shout out to all 900 of y'all in here listening to me run my mouth. We are doing NCLEX questions. I got them off nurseslabs.com. All right, free sets of questions. Make sure you guys go over there and check that out for yourself. Also, if you are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And for everybody, I need y'all smashing that like button. I need for y'all to share, and I need for y'all to follow, because y'all need to stop being greedy. What in the world do y'all think this is? James, I appreciate you for the follow. All right, y'all. Here we go. Here we go, y'all. Here we go. Here is our answer from the Philippines. Shout out to the Philippines. Here we go. Here's our answer, y'all, in 3, 2. And the answer is C. The level of the drug is 100 mLs at 8 a.m. and is 80 mLs at noon. The pump is set to deliver a basal rate of 10 mLs per hour. From 8 a.m. to noon, which is 4 hours, the pump should have delivered 40 mLs. Basic math. I don't math well, but I know that basic math, and that ain't right? So if the level of the drug was 100 mLs at 8 a.m., it should be 60 at noon, right? 100 mLs minus 40 mLs, right? The fact that it's 80 mLs at noon indicates that only 20 mLs has been delivered over 4 hours, suggesting that the pump may not be functioning correctly, especially given the patient's frequent request for PRN dosage. That is part of pharmacological and parenteral therapy, right? Second largest section on the NCLEX. All right, second largest section on the NCLEX. Shout out to everybody that got that right. Shout out to all y'all that are in here rocking with me. We're going to the next question. All right, here we go. Question number 15. During a community meeting on health promotions in a small town with a significant elderly population, the nurse is approached by a group of senior citizens. They express concerns about them damn kids skateboarding on the sidewalk. I'm sorry, I couldn't help myself. They express concerns about their chronic back pain and have heard about alternative treatment. One of them asked about the effectiveness of chiropractic treatment for their age group and associated alignments. Considering the demographic of the context and responding, what should be the focus of the nurse's answer? The motherfucking kids, I'm trying to tell you. Is it A, electrical energy fields and their role in pain management? Is it B, spinal column manipulation and its potential benefits for chronic back pain, mind-body balance and its holistic approach for health, exercise of joints and its importance of maintaining mobility, acupuncture and its role in pain relief, or F, the importance of regular medical checkups alongside alternative treatments? What are we thinking? What are we thinking? I couldn't help the damn kids skateboarding on the sidewalk. I could not help. It's not select all that apply. It's one answer. One answer, y'all. One answer. Is it Andrea or Andrea? Regardless, you can only pick one. There can only be one. Hey, we need 20,000 likes, y'all. Get carpal tunnel for me. Get carpal tunnel for me. Make it happen right now. Hey, shout out to everybody that's in here, y'all. We're doing NCLEX questions. Got them off nurseslabs.com. Look, we got some more questions, y'all. We got some more questions. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is B, spinal column manipulation. Chiropractic care primarily focuses on the diagnosis and treatment of mechanical disorders in the musculoskeletal system, especially the spine. Okay, spinal column manipulation is a central component of chiropractic treatment. Given the context of the question, where elderly individuals are specifically inquiring about chronic back pain, the nurse should focus on explaining the potential benefits and consideration of spinal column manipulation for their specific ailment. That's health promotions and maintenance. Now, listen to me. Somebody said that chiropractors are quacks. Look, hey, we're going off of what's in the book, okay? You'll hear other people say, hey, I don't believe in this, I don't believe in that, so on and so forth. Look, go off of what the book says. It doesn't matter what some other individual is going to tell you that what they believe. If that question comes across your face, you better answer it right. I'm just letting you know, all right? You better answer it right. And also, do some more research for yourself. Wow, for the elderly, right? Do some more research for yourself. There ain't nothing wrong with that. Real quick, we're doing NCLEX questions. Y'all got them off nurseslabs.com. Don't y'all go nowhere either. All right? Participate. Participation is the key. I'm kind of funny sometimes. I just said something funny and just came off the top of the dome. You know how I do. Hey, share, follow, give me all them likes. Don't be selfish your whole life. I need 20,000 likes right now. Make it happen. I love you. Appreciate you. Hey, if you act a fool in my chat, I'm going to ban that ass. AKA, I'm going to give you a 600. You try to sell me your nudes in my chat, I'm going to give you a 600. Yeah, that means I'm a ban you. Nurseslabs.com is where I got this from. Also, 7-day NCLEX course, $48, y'all. It's going up in price on Friday. Make sure you guys go over there, check that out. That link is in my bio right here. Go up here. Right there. There you go. All right. Also, if you need one-on-one coaching for the NCLEX, that link is also in my bio. And we're going to do an Ask Me Anything after this, okay? Ask Me Anything. Bella, I'm going to need for you to stop making that face, okay? It ain't about you, all right? It ain't about you right now. It's about it. All 600 other folks up in here, okay? Man, Lord of mercy. Here we go. Question 16. A 55-year-old client who is a renowned piano player, y'all, get your head out the gutter, is admitted to the neurology unit after a right-sided cerebral vascular accident following a high-pressure concert performance. Man, that performance probably was fire for him to get a stroke. Let me stop. The client's family is anxious about the potential implications of his career. The nurse is performing a neurological assessment while considering the client's profession and the family's concern. Amidst the assessment, which findings should prompt the nurse to take immediate action and possibly escalate care? Is it decrease the level of consciousness? Is it the loss of bladder control? Is it altered sensation to stimuli, especially in the fingers? Emotional, lability with episodes of sudden crying? Is it difficulty in coordinating finger movement or complaints of persistent headache? What are we thinking? What are we thinking? This is not a select all that apply, by the way. This is just you pick one and we go on to the next. All right. What are we thinking? Shout out to all 700 y'all in here rocking with me. We're doing NCLEX questions. Make sure you guys smash that like button. Hey, we need 30,000 likes. Hey, I had 100,000 likes last night. Hey, y'all think we can beat it? Y'all think we can beat it? I need y'all to get carpal tunnel for me. Get carpal tunnel for me. Bella, especially you, get carpal tunnel for me right now. Do it. Make it happen. What is NCLEX? NCLEX is the licensing exam for nurses, LPNs, LVNs, and RNs. Damn, Bella, it's like that? Fine. It ain't about me. You're right. It ain't about you. It's about me. Can you Uber what? Can you Uber Eats me food? Are you asking me to Uber Eats you food? Lord of mercy. All right, y'all. Here we go, y'all. Here's our answer. Here is our answer. Somebody says maybe A, but maybe F. Hey, give me an answer and run with it. Hey, make a decision and run with it. A good decision now is better than a great decision later. Okay. Here we go. Here's our answer in 3, 2. And yes, I'm broke. What the hell? And the answer is a decreased level of consciousness, right? A decrease in level of consciousness is a critical sign that indicates potential deterioration in a client's neurological status, especially after a cerebral vascular accident. It can suggest increased intracranial pressure, further brain injury, and other serious complications. Immediate action and escalation of care are essential when there is a decline in consciousness to prevent further complications and potentially life-threatening situations. That is physiological adaptation. The third largest section, is it Shaney? Shaney said finally, it's the third largest section on the NCLEX, all right? 11 to 17%. Hey, a change of level of consciousness is up there along the lines of your ABCs, okay? Because if your ABCs go, so does your LOC. LOC, ABC. Think about that as well, okay? Here we go. Question 17. Question 17. A 6-year-old child who has recently moved to a high altitude region with his family has been diagnosed with cystic fibrosis. The parents bring him to a pediatric clinic for an initial assessment and are concerned about how the altitude might impact his condition. They also mention that he has been more active and playing outside with new friends. Considering the early stages of this disease and the child's recent environmental changes, which later stage symptom associated with cystic fibrosis would the nurse not expect to observe at this time? So the key word in there is not. That's at 330 and my dang wrist hurt. Look, okay? Make it happen. All right. Is it positive sweat test, bulky, greasy stool? Is it moist, productive cough? Is it meconium, ileus, clubbing of the fingers and toes, or shortness of breath after mild activity? What are we thinking? What are we thinking? Hey, who doesn't like the word moist? I know that's like a trigger word for some people. What'd I say? Hey, shout out to all like 570 y'all in here. Read the question. I did read the question. I said not. What is not to expect? How am I not slick? What you mean? Hey, hold on, y'all. I got to give somebody a 600. Hold on. Hold on. Hold on. Hey, you come into my chat and try to sell me nudies when I can get them for free. I'm giving you a 600. We don't condone that kind of talk down here. All right, here we go, y'all. Here we go. Here is our answer. Here's our answer in 3, 2. And the answer is C. Moist. Moist productive cough. Cystic fibrosis is a progressive genetic disorder that affects the respiratory and digestive tract. A moist productive cough is a symptom that typically develops in the later stages of the disease as the lungs become more affected by thick mucus secretions. In the early stages of cystic fibrosis, symptoms like a positive sweat test, bulky, greasy stool, a meconium ileus are more common, while clubbing of the fingers and toes and shortness of breath can also be seen in a later stage. The moist productive cough is a hallmark late stage symptom that would not be expected in a 6-year-old with a recent diagnosis. Respiratory failure is the most dangerous complication of cystic fibrosis. That is a physiological adaptation. All right. Physiological adaptation, third largest section on the NCLEX. Okay. On the NCLEX, right? You said non-productive cough. Right. There you go. I just explained it. I'm not explaining it again. Stop saying moist. What you mean? But it was moist though. That's what it said. And that was the answer. Come on. All right. Here we go. Question 18. Question 18. During a home health visit in a remote mountainous area with limited cell reception, a nurse arrives at a cabin to find a male client lethargic and confused. Keywords: lethargic and confused. His wife seems visibly distressed, mentioned that he fell down the stairs approximately 2 hours ago while they were preparing for a storm. She added that he seemed fine immediately afterward and didn't want to worry their children who were playing in the adjacent room. Given the circumstances, what action should the nurse prioritize? Select all that apply. Select all that apply. So is it place a call to the client's healthcare provider for instructions, even if it means driving to a location with better reception, arrange for immediate transport, or send him to the nearest emergency room for evaluation? Reassure the client's wife that the symptoms are likely to be transient and will resolve soon. Instruct the client's wife to monitor his condition and to call the doctor if symptoms worsen, providing her with emergency numbers. Assess for other signs of head trauma like pupil dilation, irregular breathing, or fluid drainage coming from the ears or nose. Keep the client in a calm and quiet environment, away from the children, and reduce stimulation. Or is it G, or also G, check the home environment for potential hazards that could lead to further injuries? What are we thinking? What are we thinking? I'll give y'all 30 seconds. I'll give y'all 30 seconds on this one. 30 seconds, y'all. 30 seconds. What are we thinking? Select all that apply, y'all. Select all that apply. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. We're on the road to 30,000 likes. 30,000 likes, y'all. Let's make it happen. Let's make it happen. Also, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, did anybody pass NCLEX since yesterday? Anybody pass NCLEX? Anybody take the NCLEX on Monday and pass and not tell me so I can give you your love and your flowers? You know what I'm saying? Is it Sherilyn? Sherry Lynn? Thank you for the follow. Appreciate you. All right, y'all. All right, y'all. Here we go. I passed NCLEX yesterday. Is it Javion? Javion. Hey, shout out to you. Hey, everybody right now. Give Javion flowers. Congratulations. Welcome to the shit show. Welcome to the greatest shit show on earth, which is being a nurse. Congratulations to you. Welcome, welcome, welcome. Welcome, welcome. Congratulations to you. All right. Here we go. Here we go. Here's our answer in 3, 2. And the answer is A, B, E, and F. Following a fall, especially with a delayed presentation of symptoms like lethargy and confusion, there's a concern for a potential traumatic brain injury or intracranial bleeding. Immediate medical evaluation is crucial. The nurse should contact a healthcare provider for guidance and prioritize sending the client to the emergency room. Assessing for other signs of head trauma can provide valuable information about the client's condition. Given the scenario, keeping the client calm and reducing stimulation is also essential, right? You were close. Hey, now on the NCLEX, you can get partial credit. So being close could work. You know, is it Carlotta? Carlotta, appreciate the follow. Alex, thanks for the follow. All right. So there is our answer. Physiological adaptation. All right. Third largest section on the NCLEX exam. All right. So here we go. Question number 19. Question number 19. Another select all that apply, y'all. The Satan questions, as they call them, right? Here we go. Question number 19. A 72-year-old client with a history of recurrent urinary tract infections and recent complaints of flank pain is scheduled for a KUB, which is a kidney, ureter, bladder x-ray in an outpatient setting. The client is anxious and mentions reading various preparation methods online. Given the client's age, history, and concerns, which of the following actions should the nurse take to adequately prepare the client for the test? All right. So out of all these, which ones do we want to choose? Instruct the client that they must be NPO for 6 hours before the exam. Administer an enema the evening before the exam to ensure clear imaging. Administer furosemide, 20 milligrams IV half an hour before the examination to enhance visualization. Is it ensure the client and inform them that no special preparation is needed for this exam? Ask the client to drink water and empty the bladder just prior to the examination to ensure a clear view. Check for any allergies to contrast, even though it's not typically used in a standard KUB, or advise the client to wear loose-fitting clothing without any metal objects for the examination. What are we thinking? What are we thinking? EFG, HIJK, LMNOP. All right, this is hard. The LVN wasn't this hard. Hey, the LVN may not have been this hard, but it doesn't mean that you can't critically think, right? All right. We don't come here. Hey, we don't come here and we don't make excuses. We come here and we get results. That's what we do. That's what I'm saying. Hey, that ain't no shade against you. Hey, but if it's hard, that's telling you it's a good question. All right. And if you go for your RN, you most definitely will see a question that's like this. Who just gave me jellyfish? Shout out to you, whoever just gave me jellyfish. Is it Kabaka? Kabaka. Hopefully I said your name right. Thank you for the jellyfish. Appreciate you. All right, y'all. Here we go. Give y'all 10 more seconds. It was Karen. Is her name Karen or is it Kabaka? Appreciate you. You said it right, Kabaka. Cool. I got you. Appreciate you. Thank you, ma'am. Appreciate you. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D and E. D and E, right? So a KUB radiology is a diagnostic imaging test that provides a view of the kidneys, ureters, and bladder. Typically, no special preparation is needed for this examination. However, asking the client to drink water and then emptying the bladder just before the test can help ensure a clear view of the urinary structures. The other options, such as being NPO, administering an enema, or giving furosemide, is not a standard precaution for a KUB, all right? And that's reduction of risk potential. Smaller section on NCLEX, 9 to 12%, but still very, very much important on that exam, okay? So D and E, all right? Here we go. Question number 20. Hey, question number 20, y'all. Hey, smash that like button. We need 40,000 likes. Hey, I had 100. Let's see if we can get there today. The nurse is giving discharge teaching to a 45-year-old client, a professional athlete, 7 years post myocardial infarction. The client, anxious about returning to his normal life and activities, asks the nurse why he must wait 6 weeks before having sexual intercourse. He also inquires about the impact on his athletic performance. Given his profession and concerns, what is the best response by the nurse to this question? This is not a select all that apply. Okay. You just give me one. All right. You need to regain your strength before attempting such exertion, especially considering your profession. When you can climb 2 flights of stairs without problems or feeling shortness of breath, it is generally safe to engage in activities like sex. Have a glass of wine to relax you. Then you can try to have sex. Lord have mercy. Your heart needs time to heal, and premature exertion can risk another cardiac event. Or you should consider discussing this with your cardiologist. who can provide guidelines tailored to your athletic needs. What are we thinking? All right. Hey, shout out to everybody. Shout out to all 450 of y'all that are in here rocking with me. We're doing NCLEX questions. All right. Some of these are a lot longer. We're a lot winded today, but that's okay. So nurseslabs.com is where I got these from. You guys can go over there and check that out. You guys need to smash that like button. You guys need to share. You guys need to follow. Please, 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 please don't be greedy your whole life. All right. Get carpal tunnel for me. Autumn, thank you for the follow. Appreciate you. That's my sister's name. You my sister? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing in here? What you doing in here? Also, if you're an LPN, if you're an occupational therapist, respiratory therapist, CNA, patient care tech, medical assistant, whatever, hey, I fucking love y'all. And without y'all, we could not do our job. And I'm telling you right now, you never really understand it until you don't have those people around you. I'm just letting y'all know. All right. Alaska, shout out to y'all. RPN translate. Okay, so you must live in Canada. Shout out to my CSTs. Hey, I'm actually a surge tech as well. I am a surge tech, been one for 13 years. And I was an instructor at a surge tech program too, and I loved it. That's where I got the love for teaching. So, all right, y'all, here we go. Here's our answer. Here, can you give us some motivation? I'm giving you all the motivation right now because you here. Flight medic, shout out to you, J Money. Shout out to you. I'm a PCT in nursing school. Hey, I love my fucking patient care techs. I'm telling you right now. I love my patient care techs. I love teaching them. I love doing all that stuff. It was awesome. And the answer is B. When you can climb 2 flights of stairs without problems, it's generally safe. After a myocardial infarction, it's essential for the heart to heal, for the patient to gradually return to physical activities. The activity to climb 2 flights of stairs without experiencing symptoms is often used as a general benchmark to gauge a patient's cardiovascular fitness and readiness to engage in activities that require exertion, such as sexual intercourse. Given the client's profession as an athlete, this benchmark is particularly relevant. The other option either provides incomplete advice or are not directly related to the client's primary concern. That is part of the health promotions and maintenance. The overthinking is crazy. All right. Hey, take a breath, read your question. If you don't understand your question, then read the answers. All right. A lot of times the answers will answer what the question is asking right off the bat. Hold on a second, y'all. Hold on. You already know. I got to give somebody a 600. Hey, if y'all see anybody that jumps into the chat and it says my private whatever, y'all just let me know that is a 6. They just say 600. That'll get my attention because why buy nudies when you get them for free? All right, next. Here we go. Hey, real quick. Don't y'all go nowhere. We're doing NCLEX questions, y'all. I need for y'all to smash that like button. I need 40,000 likes. I need to happen right now. All right. 40,000 likes. All right. Participation is the key. Share, follow, give me them likes. Do not continue to be selfish your whole life. Also, share this to people. If you're in nursing school or your cohort, share it to folks. All right. Hey, if you come to my chat, you try to sell me nudies or you're rude, I'm going to give you a 600, aka I'm going to ban that ass. Literally, it says it. I'm going to ban that ass. All right. So don't be rude. All right. All right, nurseslabs.com is where I got these questions from. You guys can go over there and check those out for yourself. 7-day NCLEX course, which is my NCLEX course, $48. That price is going up on Friday. So get it right now for $48. You get it for a lifetime, ladies and gentlemen. Yes, and that means you get all the updates. Anybody that's in here right now, if you got the course yesterday or over the last couple of days, hey, am I lying? Also, if you need tutoring, check out the bootnurse.com/coaching. Those links are in my bio. All right. Here we go. Question number 21. The new NCLEX is hella easy passed. Increase 8% this year. Shout out to you, Tyler. It depends on who you are, right? You say it's easy. Other people say it's not. So bye, y'all. Study time from me. Happy Turkey Day. Appreciate you. Is it Miss Nails? Appreciate you. Have fun. Question 21. In a busy urban emergency department during a holiday weekend, a triage nurse is faced with 6 clients arriving simultaneously, each presenting with distinct symptoms. The waiting room is crowded and the nurse is aware that the ER is currently short-staffed. Given the symptoms, potential severity of each case, and the current ER situation, which client should the triage nurse prioritize to be seen first? So there's only going to be one answer. So who do I want to see first? How did TikTok know I'm going into nursing? Because it hears everything that you say, right? So is it a 2-month-old infant with a history of rolling off the bed and has a bulging fontanelle with crying? A teenager who got a singed beard while camping? An elderly client with complaints of frequent liquid brown colored stool? A middle-aged client with intermittent pain behind the right scapula? A pregnant woman in her third trimester complaining of mild abdominal discomfort, or a construction worker with a minor cut to his hand, but up to date on his tetanus shot. What are we thinking? What are we thinking? All right. Is it Chella? She says singed beard. Okay. Caitlin says A or C. You got to give me one. You got to give me one. Head injury. So you say A. Is it a head injury though? B for airway ABCs. Okay. Okay. Inhalation injury. Who said that? Gabriella? Gabriella, did you say that? Yeah, you did say that. Okay. What is a singed beard? Hey, I guess we'll find out here in a second if it pops up, right? Change my mind. He says it's B. Why? Why, Michael? Why'd you change your mind? Following with the crowd or what? Hey, that's what y'all hear me see. RTFQ. RTFQ. Read the effing question. All right. This is a prioritization question. Who do I see first? Who's going to die if I don't see them first? Okay. Think about it. Apply what you know. That way you can do the process of elimination versus trying to apply what you don't know. Okay. Here we go. Here we go, y'all. Here's our answer. A 2-month-old doesn't roll. Look at you, Heather. Look at you. I initially said, okay. Is A hydrocephalus? Okay. Babies. Okay. Decompensating and can't communicate. You're correct. They don't. They can't. Crying is the way that they communicate. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is B, a teenager who got a singed beard while camping, right? A singed beard means that fire has gone off in this kid's face, right? This client is at the greatest danger with the potential of respiratory distress. Any client with singed facial hair that has been exposed to heat or fire in close range that could have cause serious damage to the interior of the lungs. Note that the interior lining of the lungs has no nerve fiber, so the client will not be aware of swelling. That is part of management of care. I didn't know what singe mean. That's why. So here's the thing. If you don't know what it means, if you don't know, don't pick it. You would have gotten this wrong. But however, based off of doing your questions, your answers, and then understanding your rationales, you're never going to get it wrong. But any type of fire burning to the face, they're going to be an airway compromise, period. It does not matter. Or if they're burned more than 15% of their body, because then their body's going to start to swell up, which it'll cause them to have respiratory compromise. Okay. Code blue. You already know what the deal is. All right. So here we go. Question number 22. You're a pediatric nurse working with a family who has recently adopted a 2-year-old named Mia. Shout out to Mia. This is the family's first time adopting, and they are particularly concerned about ensuring that they provide the right environment for her developmental needs. Mia is an active toddler who loves exploring, but has had minor falls. During your nursing education session, you emphasize the importance of balancing safety, exploration, and skill development at this stage of Mia's life. Which of the following statements made by Mia's mother indicates that she has a clear understanding of her daughter's environmental needs at this age? I want to protect my child from any falls. I will set limits on exploring the house. I understand the need to use those new skills. I intend to keep control over my child. All right. What are we thinking? What are we thinking? Bella says I'm gonna say C. Okay. What else are we thinking? Hey, if you're new here, welcome. Hey, we're trying to get to 40,000 likes. I need for y'all to smash that like button. I need for you guys to share, and I need for you guys to follow. Make it happen. Don't be greedy your whole life. Share this out to folks who you feel may need it. Also, I got these questions off nurseslabs.com. All right, nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. Hey, if you're a new nursing student and you're looking for care plan stuff, I'm telling you, nurseslabs.com, they got you. I used them when I was in school too, and it wasn't that long ago. All right. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, all that good jazz. All right, I'm going to give y'all 10 seconds. We got some B's, we got some C's. Donna, and is it Susie? Thank you for the follow. You want to read it again? Bella, I'm not waiting on you. I ain't waiting on you. What you think this is? Wait on Bella time? I think not. Here we go, y'all. Here's our answer in 3, 2, and the answer is C. I understand the need to use those new skills. Erickson describes the stage of the toddler as being the time when there is normally an increase in autonomy, right? Anybody ever dealt with a toddler? You can't do nothing for them. And they get mad. They don't complain. They cry. They get frustrated with stuff. They're trying to figure out their sense of independence, right? The child must use motor skills to explore the environment and develop autonomy. Don't stop the child from doing stuff. Yeah, Psycho 101, right? Don't stop the child from doing stuff. You got to let them grow. You got to let them explore. Look, I have a 19-month-old and my dude falls all the time. Mostly it's because he's a boy and that's just what they do, right? So you got to realize is like they get frustrated with stuff. It's just part of growing. It's part of Erickson's, okay? Of the toddler stage. All right. So here we go. Question number 23. In a specialized medical surgical unit, you're assigned to care for Mr. Johnson, a 72-year-old male who recently suffered a cerebrovascular accident that led to dysphagia. Right. So what is dysphagia? He is being temporarily nourished through a nasogastric feeding tube. His current medications include anticoagulants, and he has a history of peptic ulcer disease. Given the patient's complex medical condition, what is the most important action for the nurse to take before administering any enteral feedings via the nasogastric tube feeding tube? Is it verify the correct placement of the tube? Check that the feeding tube matches the dietary order. Aspirate abdominal content to determine the amount of last feeding remaining in stomach, or ensure that the feeding solution is at room temperature. What are we thinking? What are we thinking? Shout out to everybody that's in here. We're doing NCLEX questions. NCLEX questions, ladies and gentlemen. Got them off nurseslabs.com. Make sure you guys go over there and check those out, okay? Hey, we need 40,000 likes. Y'all got carpal tunnel on me already? Hey, put the phone on the floor and start tapping on it. Tap on it with your toes. You put your phone on the floor. Touch it with your toes. Make sure you breathe through your nose. I'm sorry. I couldn't help myself. Shout out to Kevin Gates. Trenton, appreciate you on the follow. Autumn says A. Okay. Bella, stop making that face. All right, y'all. All right. Right here on Chrome. I know I'm right. I don't even know. We don't even know if you're right. Is it Britt Brat? Thank you for the follow. Kaylee, thank you for the follow. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is A. You want to verify the correct placement of the tube, right? You want to verify the correct placement of the tube. Proper placement of the tube prevents aspiration and entrance of food content into the lungs, right? Ensuring the correct placement of the NG tube is critical to prevent complications such as aspiration, which can be life-threatening, especially given Mr. Johnson's history of stroke and anticoagulant use. The definitive way to, is it ascertain? Oh man, I said that right. Ascertain the position of the nasogastric tube is through visualization by an X-ray. Another method is to aspirate stomach content and check pH, or check their pH, right? Aspirated stomach content can also be tested for bilirubin to confirm if it's placed in the stomach. All right, here we go. Here we go. Hey, that's part of basic care and comfort, 6 to 12% on the NCLEX lower section. However, very, very, very important. Is that Nurse Riri? Appreciate all the I gotta giving me a bouquet, girl. That's what I'm talking about. I appreciate you. I appreciate you. Thank you for the flowers. All right. There's so much to remember as a nurse. Props to you guys. There is a lot that you have to remember, and there's a lot that you're responsible for. No, this is not ATI. This is nurseslabs.com. These are NCLEX questions. It doesn't matter if it's ATI, HESI, or whatever. It's still helpful. Okay, here we go. Question 24. You are a nurse in a cardiac unit caring for Mrs. Thompson, a 62-year-old female with a history of chronic kidney disease and hypertension. She has been admitted for acute heart failure and has a serum potassium level of 3.5 on the lower end of the normal range. Considering her clinical history and current condition, she is placed on a cardiac monitor and starts receiving a infusion of 40 milliequivalents of potassium chloride at 1,000 mLs of 5% dextrose and water IV. While monitoring her EKG, which of the following patterns should prompt you to discontinue the potassium infusion immediately? Is it a narrow QRS complex, shortened PR interval? Is it tall peaked T waves, or is it prominent U waves? What are we thinking? What are we thinking? This right here, ladies and gentlemen, is where it's important for you to understand content. What happens if your potassium is too low or if it's too high? What is the EKG gonna read, right? Hyperkalemia, that's T for tall. Look at you. He's so smart. Who said that? Who said that? Cass is here. Cass, you're so smart. I'm so proud of you, girl. That's what I'm talking about. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Hey, I need 40,000 likes. Hey, I need 40,000 likes right now, or I'm boycotting the rest of these questions. I'll say explosive diarrhea, really. Hey, I need 40,000 likes. Make it happen right now. All right. Also, questions. I got them off nurseslabs.com. Okay. Make sure you guys go over there and check those out. They're free sets of questions. If I boycott, hey, at least you know where to go get the questions from. All right. Also, I want to know who you are, where you're from, where you are at in your nursing journey. And if you're not a nurse, cool. What you doing here? Let us know what you do. Haha, them potassium poops. Hey. You ain't lying. You ain't lying. You ain't lying. All right, y'all. I'm going to give y'all 10 seconds. A says it's C with a question mark. Tall peak T waves. Okay, John. I was literally about to say John Travolta, and I don't know why. I'm sorry. NCLEX in 5 days. Is it Bill Jess? Bill Jess? Shout out to you. Hey, you're gonna rock that NCLEX. You're gonna rock it. All right, y'all. Here we go. Here we go. Bella, I am not paying attention to you, even though you just said my name. Here we go. Here's our answer in 3, 2, and the answer is C. Tall peaked T waves. T for tall, right? Tall peak T waves are a classic sign of hyperkalemia. Given Mrs. Thompson's chronic kidney disease and acute heart failure, continuing to infuse potassium with an EKG finding could be dangerous. There's no could, it is dangerous, right? The infusion should be discontinued immediately. That is part of pharmacology or pharmacological and parenteral therapies. Where is the twerking emoji? Look, you can't be dropping no twerking emojis inside here. If you could, I'd laugh. I'd be like, hey, yo, drop those all the time. You know what I'm saying? Oh, my God, I'm correct. Jay, don't be so surprised that you smart out here. You know what I'm saying? So, hey, second largest section on the NCLEX, okay? Second largest section on the NCLEX, all right? Question number 25. While working in the pediatric oncology ward, Nurse Ramirez manages care for Leo, a 4-year-old boy newly diagnosed with rhabdo. I'm just going to say rhabdo because I always mess that up. Oh, rhabdomyosarcoma. Yep. Leo's parents are anxious as they've been reading extensively online and are overwhelmed with information. Good old Google University telling them the answers, right? They express concerns about potential metastasis and how the cancer may affect Leo's overall function. Given the primary site of rhabdomyosarcoma, Nurse Ramirez should emphasize monitoring the function of which area of the body and educate the family about its relevance. Is it all striated muscles? Is it the cerebellum, the kidneys, or long bones? What are we thinking? What are we thinking? Kev, this was all on my final. Hey, that's what I'm saying. It is crazy, huh? Rhabdo is protein, and I will go with kidney. All right, Jay, cool. We'll go with kidneys. Well, you'll go with kidneys. I'll go with the right answer. And I didn't say that the kidneys were right or wrong. Okay, look, okay. Don't be flipping out on me now. Don't be flipping out on me. Sally says the kidneys. Hey, if you guys are new here, welcome. Hey, we're trying to get to 40,000 likes, or else I'm boycotting. I'm boycotting everything. All right. 40,000 likes. We're trying to get there. All right. Hey, also, I got these questions off nurseslabs.com. Right. Annie, did Annie or Ann? Annie said a fibrous tissue and muscles. Okay. So you say A. Thank you. Thank you. You so cute. Girl, stop. You know what I'm saying? I'm trying to be cool out here. Hey, free Palestine. Hey, sure. Whatever you want. All right, hold on. Let's see what we got. Rhabdo, knees. Okay, hey, I'm going to give y'all 10 more seconds. How to memorize the cranial nerves fast. I don't know if it has anything to do with this question. I'm about to tell you the answer, but I can't tell you that right now. And find a good mnemonic. You such a nice person. Look, I'm out here doing God's work and my work. So here we go. And our answer is A, all striated muscles. Who was it? Was it Annie that got A? You know what I'm saying? Cranial nerves, the face acronym. Okay. Hey, so rhabdomyosarcoma. Listen to me, y'all. Listen. Yeah, look at you, Bella. Got it wrong. Sad face. Looking at. No, I'm just playing, Bella. I love you. Rhabdo is the most common children's soft tissue sarcoma. It originates in striates, so skeletal muscles, and can be found anywhere in the body. Right. Symptoms of rhabdo include if the cancer is in the head or neck area, sudden bulging or swelling of the eyes, conjunctival was a chemosis, and headache. It can also affect the urinary and reproductive system. Its common site of metastasis is in the lungs. Leo's muscle strength, function, and any pain in areas of striated muscles should be continuously assessed. Educating the family about the origin of this cancer can help them understand the primary area of concern. That is part of physiological adaptation. Myo meaning muscle. Look at you, Molly. Molly. Hold on one second, y'all. I got to get somebody else to 600. 600. You already know the deal. Myo. All right. Here we go. Hey. Physiological adaptation, third largest section on the NCLEX, y'all, at freaking, right? At 11 to 17% on the NCLEX, all right? Hey, Bella, I banned that person. Don't worry about it. You know I give 600 to nudie peoples. So here we go. Hey, real quick, NCLEX questions, y'all. This is what we're doing. What I need for y'all to do, participate, share, follow, and give me all them likes. Hey, we need 50,000 likes. Hey, 50,000 likes right now. Get carpal tunnel for me, especially Bella. Make it happen, all right? Hey, don't troll my chat, all right? Don't troll my chat. You troll my chat, try to sell me nudies, try to rush me. I'm giving you a 600, promise you. And I'm petty, and I'll talk about you at the end of the live. I swear to God. So don't be selfish your whole life, all right? Nurseslabs.com is where I got these questions from. Also, my NCLEX course, 7-day NCLEX course for $48. You get it for a lifetime for $48. It ends on the 23rd, which is Thursday, which is tomorrow. So I'm trying to tell you, biggest flex you could ever have is having an NCLEX review for $48. I have a new generation NCLEX review in there that goes over 100 questions, okay? Over 100 questions. And I'm putting more in there and you're going to get all the updates, all right? And if you need tutoring for NCLEX, those links are also in my bio. Check them out. And we're going to do an Ask Me Anything to follow this, okay? Do you do one-on-one? Yes, I do. I don't know what your name is because it just looks like dashes. But yes, to answer your question. Question 26. While working in the oncology ward, Nurse Parker cares for Mr. Lee, a 65-year-old patient diagnosed with colon cancer. Mr. Lee and his family are deeply rooted in their cultural beliefs, emphasizing the traditions of Chinese medicine in their approach to health and healing. Hey, this is a very big deal if you guys have never experienced this before. Cultural beliefs, okay? In addition to the prescribed cancer treatment, Mr. Lee's family seeks to incorporate complementary therapies that align with their cultural beliefs. In developing a holistic care plan in collaboration with Mr. Lee's family, Nurse Parker should prioritize understanding which fundamental goal of Chinese medicine. Is it achieve harmony? Is it maintain a balance of energy, respect life, or restore yin and yang? There we go. Molly gave him said, "Yeah, okay. Them Chinese people don't talk, man. Look, hey, they're a very silent culture. They're a very silent culture. They really are. I've only had to really personally deal with one. Most of mine have been Hispanic or have been Indian, actually. Yin and yang. Okay. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Hey, we need 50,000 likes. Also. I got these questions off nurselabs.com. Go over there and check those out for yourself. And also, I want to know who you are, where you're from, where you're at in your nursing journey. You know what I'm saying? Don't be selfish. Talk to me. You know what I'm saying? It says, I don't know. I feel like D is racist. You can feel like it's racist, right? But it could be the answer. But it's, yin and yang is a very real thing. And it's not like, I ain't talking about the yin yang twins, okay? Yeah, I'm showing my age right now. All right, y'all, here we go. Literally a kinesiology major. Hey, that's okay, though. You here, though, and that's all we care about. Getting your learn on. Here we go. Here's our answer in 3, 2. I have my bachelor's in business, but I started nursing in April. Shout out to you, Queen 7. And the answer is whatever yin and yang is, because, that was a racist answer, I guess. It's not, okay? It's not a racist answer. All right, the principles of yin and yang are foundational to Chinese medicine. Yin and yang represents the opposite and complementary forces that exist in nature and the human body. An imbalance between these forces can lead to illness. Restoring the balance between yin and yang is a primary goal in Chinese medicine and is often seen as essential to overall health and healing. Traditional Chinese medicine is a medical system that began being developed in China about 5,000 years ago, which makes it the oldest continuous medical system on the planet. That's part of health promotions and maintenance. Y'all, it's been around for a while. Is this how easy it is? Maybe, could be. All right. Hey, so that's at what, 9 to 12% on the NCLEX. Okay. Some are easy, some are not. I'm telling you right now, if you get very easy questions on NCLEX, you might want to start rethinking. NCLEX is about critical thinking, clinical judgment, using your like analysis and application. If you start getting memorization questions and like memory or remembering, you're not doing so hot. Trust and believe me when I tell you. Okay. Here we go. Question 27. Nurse Johnson is reviewing Mr. Garcia, a 58-year-old client with a history of hypertrophic cardiomyopathy and a recent episode of upper respiratory tract infection. During today's assessment, Nurse Johnson notes that Mr. Garcia's systolic blood pressure has decreased from 145 to 110. Hey, that's huge, by the way. His heart rate has risen from 72 to 96 beats per minute, and he has been experiencing periodic dizzy spells when standing up. Mr. Garcia mentioned he has been trying to drink less due to concerns about fluid retention. Considering his clinical picture and history, Nurse Johnson should advise Mr. Garcia to what? Increase fluids that are high in protein, restrict fluids, force fluids, and reassess the blood pressure, or limit fluids to non-caffeine beverages. What are we thinking? What are we thinking? What are we thinking? Hey, shout out to everybody. Shout out to all y'all. We're doing NCLEX questions. Got them off nurseslabs.com. Okay. Hey, we're on the road to 50,000 likes. I had 100,000 likes yesterday, y'all. Hey, we need at least 50. All right. Get carpal tunnel for me. Do it because you want to. Okay. Jeez. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, hold on, guys. Sorry about that. Hey, also a little bit about me. I failed my NCLEX 3 times, y'all. I failed it 3 times and I passed it on the 4th. And no part of me cares that I tell y'all that. You want to know why? Because I understand exactly what you guys are going through and have been through, especially for those who haven't passed. All right. Just letting y'all know. Don't let no test determine what type of nurse that you're going to be. You know what I'm saying? Because people try to gatekeep that shit, and I don't like it. I don't like it at all. I don't like that shit at all. So I'll tell y'all flat out, I failed my exam 3 times and passed it on the 4th. You want to know why? Because it could happen to you, but don't let it determine what type of person that you're going to be. Hey, there it is. There's that motivation that somebody said that they wanted. Yo, I'm bringing it to you. I'm telling you right now. All right, here we go. And the answer is C, force fluids and reassess the blood pressure. Given the drop in the systolic blood pressure, increased heart rate, and the dizziness, it might be appropriate to advise Mr. Garcia to increase his fluid intake. After doing so, reassessing his blood pressure can provide viable feedback on his volume status. Orthostatic hypotension, a decrease in systolic blood pressure of more than 15 millimeters of mercury, and an increase of heart rate of more than 15%, usually accompanied by dizziness, indicates volume depletion, inadequate vasoconstrictor mechanisms, and autonomic insufficiency, right? That is a physiological adaptation issue, all right? Third largest section on NCLEX, 11 to 17%, okay? So think about that. Think about that. I got POTS after, oh, Lord have mercy, okay. Hey, well, I'm glad that you're here. I'm glad that you're here, Molly, all right? You know what I'm saying? You got it. I was right. Well, I'm glad that you were right, Bella. I'm glad that you were right. All right, so on to the next one. All right, I thought you never force. It's not. So it says you force them. You tell them to drink it, right? We're not bolusing them, right? Because he's still conscious. You know what I mean? So and we don't. In the real world, we don't force. That's a bad choice of words, to be honest. So that's a bad choice of words. Not my question. I would have never used. Yeah, force is crazy, definitely, right? But you definitely want to make them increase their volume for sure. Question 28. Nurse Matthew is caring for Mr. Turner, a 72-year-old client with a chronic heart failure and recent episodes of pulmonary edema. Given Mr. Turner's deteriorating condition, the cardiology team has decided to insert a pulmonary artery catheter or Swan-Ganz catheter, right? To obtain more specific information about his heart functionality. When explaining the procedure and its purpose to Mr. Turner, Nurse Matthews should emphasize that the catheter will primarily be inserted to provide information about what? Stroke volume, cardiac output, venous pressure, or left ventricular functioning. What are we thinking? What are we thinking? Also, shout out to all 360 of y'all in here rocking with me. Hey, we're on the road to 50,000 likes. Hey, 50,000 likes or I'm boycotting. I promise you. right? Boycotting. I got these questions off nurseslabs.com. Nurseslabs.com, okay? We need to know how the heart is working. All right, cool. Is your name Anastasia? Is that what it says? Anastasia, like the movie? Okay. All right, Miss Anastasia. I got you. All right. Yeah, but I got these questions off nurseslabs.com. Okay, you guys can go over there and check those out for yourself. Especially if you're a pre-nursing student or a nursing student, they're great for while you're in school. Okay? Pulmonary edema is to do a forcing back into the left ventricle. Look at you. Frida, appreciate the follow. Okay. All right, y'all. Let's see. Venous pressure is too vague. Okay. Got some smarty pantses up in here. Some smarty pantses. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D. Left ventricular functioning. The catheter is placed in the pulmonary. The catheter is placed in the pulmonary artery. Information regarding left ventricular functioning is obtained when the catheter balloon is inflated. Right. Hey, if you've never seen a Swan Gans before, I had a nice drawing of it when I first learned about it, like actually on a patient. Learning it in a book is cool, but understanding it, how you do it in a patient, look, you go in that wrong port, you killing somebody. I'm telling you, it's kind of like an A-line. You know what I'm saying? But I learned a lot about it when I was working on the ICU and when I was working in the burn unit, especially. You learn a lot. All right. Reduction of risk potential. Okay. Reduction of risk potential. Think of your heart chamber's left pulmonary. Yup. There you go. All right. Here we go. On to the next one. Here we go. Question number 29. In the middle of her night shift, Nurse Swift, and that's not to be, mistaken for anybody that's a Swiftie, because I am not. I do not like her. I said it. Y'all can get me on camera saying it. Don't care. Nurse Swift is alerted by a telemetry alarm from room 1989. She rushes in to find Mr. Taylor, a 74-year-old client with a history of congestive heart failure and recent pneumonia, unresponsive in his bed. The monitor shows ventricular fibrillation. After urgently summoning assistance using the emergency call system, Nurse Swift has to quickly decide her immediate course of action. What should be her primary intervention? Start an IV, initiate CPR, establish an airway, or obtain a crash cart. Which one? Which one we want to do? Hey, yeah, y'all heard what I said. Taylor Swift, 1989. Look. You see what happened there? Y'all see what happened there, right? I still don't like her. Don't care. All right. Man, hey, give me 50,000 likes. Stop playing with me. All right. Hey, make it happen. Oh my God. Y'all funny. Y'all are so funny. I'm gonna give y'all 20 seconds. You ain't giving me what? They said, I'm not giving no likes. Why? Don't be selfish. You come over here and get all this knowledge and you don't want to give me no likes? Ma'am, that is rude. Rita, thank you for the follow. Appreciate you. Oh, I see Nurse Monet. I see you in there. All right, y'all. Here we go. He said, it's okay. I got you on the likes. Is it Kaylee who said that? Oh, Kaylee, I appreciate you. Now you're my new friend, Kaylee. I appreciate you. Here we go, y'all. Here's our answer in 3, 2. And the answer is B. Initiate high quality chest compressions, right? As per new guidelines, the American Heart Association recommends starting CPR with chest compressions. Start the CPR with 30 chest compressions before checking the airway and giving rescue breaths, right? Starting the chest compressions first applies to adults, children, and infants needing CPR, but not newborns, okay? You pass your NCLEX. Oh, Lord have mercy. That's what I'm talking about. You passed your NCLEX. Hey, everybody stop what you're doing right now. Give her love. Tell her congratulations. Give her flowers. Ma'am, welcome to the greatest shit show on earth known as nursing. Doesn't matter if you're an LPN or RN. Let us know. How you felt about it. Also, what advice would you give to everybody in here? I need everybody to give her love right now. Do it, and do it now. CPR can keep oxygenated blood flowing to the brain and other vital organs until more definitive medical treatment can restore a normal heart rhythm. All right. AFib is also pulseless. Yep. VFib equals CPR. Yep. Hey. There's nothing that's there yet. Hey, it's based off of the 4 that we got, right? Usually, hey, if they say, hey, you have the crash cart with VFib, you defib, right? You better start them chest compressions. You better start them. It is a lethal arrhythmia. Correct. You are right. But congratulations to you, ma'am. Congratulations. All right. Congratulations. Shout out to y'all. Get me to 50,000 likes. Appreciate y'all. Appreciate y'all. Here we go. Here we go. LPN and I got it right. Just because you're an LPN and you got it right, that don't mean nothing. And I don't mean that in a disrespectful way. All right. I want you to get this, but you being an LPN has nothing to do with that. It's because you smart, girl. You know what I'm saying? You know what I'm saying? You said, I like that. Well, yeah, with VFib, you defib. That's what you do. That's what you do. I appreciate Olivia. Is it Olivia? You're welcome. Hey, I do this every Monday, Wednesday, and Friday, but this week I'm doing it all week for Thanksgiving, baby, for this week. Here we go. Question number 30. Nurse Martinez is tending to Mr. Rodriguez, a 67-year-old patient with atrial fibrillation, right? He has been on digoxin, also known as Lanoxin, 0.25 milligrams daily to control his heart rate. His cardiologist, aware of his medication regimen, has added metoprolol or metoprolol, however you want to pronounce it, right? 25 milligrams BID to further manage his condition. Before Nurse Martinez administers the two medications, she carefully assesses Mr. Rodriguez's vital signs. Which of her findings would be of greatest concern and necessitate immediate communication to the cardiologist? The blood pressure being 94/60, heart rate of 76, urine output of 50, or respiratory rate of 16. They wilding for adding beta blockers. Hey, is it Kirsten? Shh, be quiet, Kirsten. Shh. Don't be ruining the stuff out here. You gonna give out the answers. He trying to make that BP 60. Look, cardiology. Hey, look, okay. Hey, this is why nurses are so important, because doctors will make some crazy they will give them some crazy ass prescriptions and be like, hey, sir, ma'am, whatever you identify as, medical doctor, you know that you prescribed this, right? And you know that they have X, Y, and Z going on, right? Oh, yeah. My bad. And that's what you'll get. I'm telling you right now, nurses save doctors so much. But the most important thing is that you save your patients. I'm telling you, I'm a huge advocate. If you guys go over to my bio and you guys see my Why I Quit the ICU Part 7, I don't play about advocating for my patient. I promise you. I am that dude. I will advocate for a patient all the way. I will treat you like you were my mom, like you were my dad, like you were my siblings. I don't play that game at all. All right, y'all, here we go. Let's find out what the answer is together. Harry Potter style, walking through platform 9 3/4 at the end of the Deathly Hallows Part 2. Here we go. Here's our answer in 3, 2. And the answer is A. That blood pressure is 94/60. Both medications decrease the heart rate. Metoprolol affects blood pressure. All right. Therefore, the heart rate and the blood pressure must be within the normal range. Heart rate 60 to 100. Blood pressure must be over 100. Systolic blood pressure must be over 100. Right. In order to safely administer both medications, the combination of both medications might further decrease his blood pressure. This is a significant concern and should be reported as part of pharmacological and parenteral therapies. This is why it is important. Right? This is why this stuff is important. All right. If y'all are finding value, smash that like button. I need 60,000 likes. Make it happen. I'm telling you, nurses all the time save doctors' asses. I'm telling you. All right. And I mean that in a respectful way, because I know doctors got a lot going on, but we also got a lot going on. All right. So just being aware. I heard a dentist scene was scary. Look, when you see a Sicily pop up on that line, when you drop that, look, I'm trying to tell you, you're just like, please come back alive. Please, heart, jump back up. Please. Right? So, hey, it happens. All right. Hey, ladies and gentlemen, that is it tonight for the questions. Hey, this is day 3. Day 3 of doing NCLEX questions, y'all. So that is a wrap. First of all, I want to say thank you to every single person that came here, and I appreciate you guys participating. I blocked like 5 or 6 people. One dude who came in here talking stupid shit. The other dude or the other girls or whatever the bots are trying to sell me nudies when you can get them for free. You know what I'm saying? So, hey, I enjoy being petty. Come over here and be stupid. I'm going to ban that ass. I promise you. All right. So I appreciate all the loves and all the like and all that good stuff. Right. Once again, I got these questions off nurseslabs.com. Right. Yeah. Bella, you are passing that NCLEX. Don't play with me. Kay says, hey, Kevin, everybody. I took my NCLEX yesterday morning. Hey, that's what I'm talking about. Hey, everybody right now. Give Boy Mom 311. Hey, go ahead and give her props right now. She comes to the lives all the time. Her and I have talked. ma'am, hey, congratulations to you. Now, welcome to the greatest shit show on earth known as nursing. First of all, what type of nurse are you, and what advice can you give to people who are going to take their exam? Okay, what advice do you got? Also, real quick, 7-day NCLEX course. Lifetime access to the 7-day NCLEX course, y'all. $48. You get it for a lifetime. That link is in my bio, right? Also, if you want one-on-one coaching, that link is also in my bio. And now we're going to do the Ask Me Anything. But before we do that, I'm going to show you what the course looks like, all right? Right here, ladies and gentlemen, this is the website, right? This is the website. Let me show you. Hey, there's a countdown right here. And yes, this is a live countdown. When this countdown is over, when it is over, this page is gone, but the course is still there. So you still have access to it, right? It is an on-demand content course, y'all. On demand, you do it as frequently or as infrequent as you want. The reason why I call it the 7-day NCLEX course is because I've been to 3-day NCLEX courses, and let me tell you. Oh, Kat, you haven't? Kat, I got you. As a matter of fact, Kat, send me a DM, or as a matter of fact, check your junk mail first. And if you still don't got it, let me know and I'll resend your stuff to you. Okay. So right here, $48, y'all, $48. And yes, you get it for a lifetime. You get it for a lifetime. Okay. That link is in my bio up here. Right there. Yeah, click that, go to my bio, go to the link. It'll say 7-day NCLEX course, okay? And the reason, like I said, I did it that way is because I have been to 3-day NCLEX courses, and I personally don't like the fact that all this information gets crammed into my head. I checked the junk and not there. You may have to push it through. I got you, Kat. I got you. Hey, send me a DM with your email. That way I make sure I send it to the right person. Okay. So here's what's inside the review, right? It's really helped. I'm on the pharmacology lessons and loving it. Hey, Monet, I really love that you like that. I really do. So here, look, this is what you get, y'all. This is what you get. We talk about computer adaptive testing. Hey, in each video is less than 30 minutes. Monet, let them know what's up. Let them know what's up, right? So it's less than 30 minutes, right? So that's me talking. We talk about the NCLEX, the NCLEX structure, all the things that happen right here. Let me show you this other one right here, right? Where we talk about when you answer questions on the NCLEX, y'all, look, if you get it right, it'll give you a harder question. You get that right, it'll give you a harder question. If you get it wrong, it will make your question a bit easier. That is how it is measured. All right. Computer adaptive. All right. That's how it's measured. All right. Over here, look, I have an NCLEX review, right? 4 hours worth, 4 hours worth, right? 8 videos. Each video is less than 30 minutes, right? Right here, we talk about the changes to the NCLEX, the questions that have been added, the test structure, the length, and then we jump into questions, right? We jump into questions. Which orange is more orange? What you mean? What does that even mean? So, you got that right there. You got that right there, right? And we go through them and I talk about them, right? We talk about how to understand the topics, right? How to understand the questions, why the question is right, why it is wrong. And then we go on, right? And there's also in here, let's see, there's also, I think it's this one, which it is. We'll hit play. I also have, let's find it. Y'all give me one sec. Right there. Those are case studies, right? You get 6 questions per case study. You get all that information that's in there that you're going to need in order for you to answer that question, right? So the first question that comes up, right? It's essentially a multiple choice. Get one right. And then you get to refer to the case study again, and then you answer the questions again, right? This is a select all that apply. Remember, select all that applies are freaking, they're what are they? They're partial credit. You know what I'm saying? Hold on. Somebody says fraud and a Ponzi scheme. Hey, Sub-Zero Avatar. I don't know if you're cold or if you're slow or if you're both. How is it a Ponzi scheme if you've never bought it, my guy or my girl or whatever you identify as? You know what I'm saying? So you can't say something is a Ponzi scheme if you've never been a part of it. So anyways, on to the next. So yeah, this is what you get. Also down here, y'all, I have all these content videos. Right? So right here, talk about preparing for NCLEX, NCLEX prep, pharmacology. Y'all, I got 18 videos right here. 18 videos. 18 content videos in pharmacology, right? And I plan on putting in more. Also, fluid electrolyte imbalances, as well as we talk about endocrinology and cardiology. You get it for $48. You get all of the updates. You get all of the updates, ladies and gentlemen. That's what you get with the 7-day NCLEX course. Also, what I will tell you is I named it the 7-day NCLEX courses because I've done 3-day NCLEX courses over the weekend, and they are exhausting, and you feel like you may not retain a bunch. That was me, and I've been an educator, right? So I figured out, like, you know what? What if I asked for somebody to give me 2 to 3 hours a day for 7 days? We do a couple of hours for management of care. We do a couple of hours for pharmacology, so on and so forth, right? And, you go on about your day. You got a life, you got family, you got a job, all that good stuff, right? So it says, is this for a lifetime? Yeah. Is it GEET 1111? It is for a lifetime. It is for a lifetime. I'll show you right here. So right here, this is the page that you guys are going to see, right? And it says it's the pre-launch bonus. The pre-launch is going to end on Friday. So it's $48 and you get access for lifetime access. Yes, I said a lifetime, right? And you get it for $48, right? Normally at $347. And I'm telling you right now, that $347 price is coming, y'all. It's coming. All right. We talk about NCLEX mindset. We talk about the structure. We talk about critical thinking. And then we dive into the review. There's a couple of other videos in between there. But like I said, it's on demand. You get all that stuff on demand. And also on the website, I go through the curriculum, everything that comes inside the course. Like, look right here, the content vault. A lot of this stuff isn't even in there yet, and you are going to get it. What time is the finish tomorrow? What you mean? What time is the finish tomorrow? And like I said, here is what we got, right? Okay, I'll go ahead and I'll like the chat. All right, Bella, I appreciate you. I love oncology. Look, I got a bunch of stuff that's going to be going in here, right? So like down here, over here towards the left, you know what I'm saying? And one of the biggest things that I really pride myself on is this. Like, I love the whole thing, but this big thing right here, as in this NCLEX review, I'm super proud of that, right? And then also probably one of my favorite lectures, and Monet, if you haven't gotten there yet, my diuretics and my medication, my cardiovascular meds are awesome. Like, I love this one. So what says, if I want to buy it tomorrow? If you want to buy it tomorrow, it'll be there. It'll be there. Is it Navi or Navy? I have a buddy named Navi. That's how he pronounces it. From Canada. Shout out to you. If you want to buy it tomorrow, it'll be $48 if you want to buy it tomorrow. Unpopular opinion, specialty, hospice care. Are you asking, or is that what you're doing? Oh, that's your goal. Okay, I got you. Is it Ricarbro? Ricarbro. Yeah, you're welcome. No problem. But yeah, this is what's inside of the course currently. Right now, in production, the 7-day NCLEX review, as well as cardiology lectures, and content. Okay, that is what's inside the review right now. It says, what about on Friday, my payday? On Friday, it's going to $97. You still get unlimited access, but from Friday all the way through Cyber Monday, it's going to be $97. On Monday, it's going to its full price. Ricarbro says, I will buy it tomorrow. Hey, get it. Is this review for both RNs and LPNs? Yes. Is it Cassidy? Yes, it is. It is. I'll turn this camera. Oh, Hey, we still there? We still there? Hey, I don't know what happened. I don't know what happened. But of course, here I am, ladies and gentlemen. If you guys are new here, welcome, welcome, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. I don't know what happened. I don't know if it was my phone or my camera or one of y'all are hacking me. It's kind of weird. But hey, shout out to y'all. First of all, if you guys are new here, welcome. We do NCLEX questions right at the beginning. Okay, we go through it's about an hour to an hour and a half, depending. And then we jump over to the Ask Me Anything, and I talk about the course, so on and so forth. Navi said, I just joined from where I can get the subscription. What do you mean, Navi? Oh, so Navi, if you're looking to get the subscription, go up here. And it's not a subscription. Well, I mean, you buy it, but you have a lifetime access to it. So you go up here to the link in my bio, right? Go to the link in my bio, tap on where it says 7-day NCLEX course, and it'll take you directly to that website that I was showing earlier that has a countdown on it. Okay. So, hey, yesterday, y'all, I had 101.7 thousand likes. I don't know if we can get to that tonight, but that would be beautiful. You know what I'm saying? So, like I said, my name's Kevin. I've been a nurse for 3.5 years. I've worked in a burn ICU, a medical, and a neuro ICU. I've worked in PACU, and I've also worked in the operating room. Loved it. I love being a nurse. But just because you're an RN or an LPN or whatever does not mean that you have to work bedside. I have wanted to go towards education for quite some time, and that is the direction that I am going. So bedside is not really my thing anymore. I'll tell you completely honest. But depending on what type of nurse that you want to be, you have to go bedside. Bedside is where you do. I work outpatient now. Shout out to you, Anastasia. What type of nurse are you? How did you like the operating room? I loved it. So I have been in the Navy for 16 years. Of those 16 years, 13 of them, I've been a surgical tech. I've been a surgical tech instructor. I've been a clinical coordinator. I've done all kinds of things while I was on active duty in the military. And so I've been in the operating room for 13 years, right? Minus like the 2 years where I was doing ICU, but I've been in the operating room for 13 years. And so when I went back, it was just like riding a bike. It's just every OR has different nuances and they're kind of different. But I think it's great. A lot of people say, no, don't go there because you're going to lose your nursing skills. Who cares? And I say who cares because it's not about you. It's not about them, what they want from you. It's what they want for you. It's what you want for yourself. If you want to go in the operating room, go do it. They have residency programs for them. Stop letting these people try to dictate what you want to do. Lil Hoover says, thank you for your service. Hey, I appreciate your support. Thank you. I'm wanting to get into peds nursing. Monet, you can definitely do that for sure. You can definitely do that. Went from family med and now I'm a triage RN for urology. Shout out to you. I bet you loving that too. You just finished bedside. Is it Haley? Yeah. Hey, whoop. Shout out to the OR. Shout out to the OR. Right. But yeah, so that's a little bit about me. But one other thing is I failed my NCLEX 3 times, y'all. If you're new here, I have failed that exam 3 times. First time, 75 questions. Second time, 265 questions. And third time, it was 106 questions. Right? I'm telling you, it's crazy. The best nurse I've met failed multiple times. Facts. You want to know what else? No one cares. No one cares how many times you failed that damn exam. Who said they've been a Gen with your search tech for 24 years? Shout out to you. Shout out to you. I 13. So I can't, you got 10 more years on me for being a tech. You know what I mean? So no one asked if you failed. No one asked. No recruiters, no hospitals, no nothing. Right? I tell people that I failed because I want you to realize that no one fucking cares. And when I tell you no one cares, I tell you that no job out there cares. And that exam does not determine the type of person that you are, the nurse that you want to be or that you will become. You care. I'm so defeated. Sherry, okay. You care about the fact that you failed. But you caring about the fact that you failed will keep you where you are unless you decide to let that fuel you to taking your exam again. Or, taking it for the first time. I did NICU for 3 years. Shout out to you taking care of them babies. Jen said, I don't. They just want to see you. That's it. They don't. The license is a license. That's facts. Oh, wow. I thought they would find out if you failed. No one fucking cares that you failed. You know what? I openly told my directors, all of them. I was just like, yeah, I failed my NCLEX 3 times. They're like, what? That's crazy. Then you became a nurse. You still didn't give up? You're better than me. Well, I guess I am better than you. Because I don't give a damn if I tell you that I fail, because you don't dictate what type of nurse that I am. I do that. And that should be the thought process for every single one of y'all. That's called having some type of accountability. You fail, it's your fault. I don't care what nobody says. If you fail, it's your fault. But the next thing you need to do is figure out, what can I do? What did I do that I wasn't doing before? And then improve upon it. All right. If you guys are finding value, smash that like button. OK. I was a dialysis nurse for 5 years, then a clinical manager, now outpatient for 13. Shout out to you. I really don't know what I'm doing wrong. Cassidy, there could be many things that you're doing wrong, but you just don't know it. And it takes somebody who's an outsider looking in, being like, who's walked the line that you've walked, being like, hey, girl. I don't mean that in a disrespectful way, by the way. It's like, hey, you're probably doing this. Or, hey, let me ask you these specific questions. And if you answer any of them the way that I think you're going to, I'm like, all right, cool. That's how you can adjust. You know what I mean? I thought they would find out. Nope, they will not find out. They don't care. Because when they look you up, when they look up your license on the Board of Nursing, it doesn't say, Nurse Monet, and you failed 14 times and that you have a license. That doesn't say that. It doesn't do that at all. I say that all the time. And also they don't ask about your GPA. I literally heard a nurse instructor say to them, you can't go to the ICU as a brand new nurse if your GPA is below. That is the biggest crock of shit that I have ever heard in my entire life. I'm just like, they don't fucking ask you about that. Shella said, I just failed last May and recent results were near passing. So if you failed last May and recent results are near passing, now you just need to go back and you need to figure out where your issue was. And you need to improve upon it. So what subject was it? And then you improve upon that. Yep, I quit nursing school 10 years ago and had 1 year left to finish, but got so discouraged. And now look at you. You know what I'm saying? You just, who said, is it chick style? You just purchased it? Hey, so if you saw what I saw when I was showing you, hey, fact check me. Is it all in there? Is it all in there? And I think not Nay. I know, I got you. Beauty, what's up, Bella? You still in here? If you can fail the NCLEX and pick yourself up from the times you messed up in nurse facts, let me tell you something right now. You failing the NCLEX is the least of any worry that you could ever think of, because I'm telling you, you mess up as a nurse, it's 1,000 times worse. What did you do differently to pass on the 4th time? I'll tell you here in a second, Sherry. I'll tell you right now. First of all, I needed accountability. And that's what I'm going to tell every single person that's taking their exam. You need to have some accountability. I'm actually working on a video right now that's going to go on the course talking about accountability of what I didn't do and what I said I was going to do, and I still didn't do it. So if I didn't do what I said I was going to do, it should be no surprise on why I failed. And that's what happened. So I had to take some accountability. Time management was another one. It took me 11 years to get through nursing school. Because get and withdraw, and I keep going back. I hear you. I had a long talk with my mom, who was a nurse, and brother, who is a doc. I'm determined to finish this. Yes, ma'am. You sure are. They don't care if you fail your school. Yep. They don't give it. They don't care. Is the NGN supposedly easier to pass than the previous? It depends. It depends on you, right? Hindsight's 2020. I think that the new gen material that's out is easier because with the case studies, they got partial credit, as well as that they give you they give you all the information in the case study, and you need to know how to use your critical thinking and to make a clinical judgment, right? That's what that means. So if they give you all the information based off of all the content that you've been absorbing, you should be able to answer it, right? But I've seen people that have taken the new gen and failed it. You know, like, you really have to get a hold of what you're doing wrong, and you have to practice. There is no easy way to study. There's no easy way. Like, this is not meant to be easy. I hear people say, hey, look, I know a trick. There's no fucking trick. It's called fucking working hard. You see what I'm saying? Miss Barbara, ma'am, how are you? How are you? They only care if your school is accredited. Facts. And if you have a license. Hey, no fake nurses around here, all right? Shout out to all my Florida nurses if you guys are real out there. Guess what happened to the nurse who graduated at the bottom of the class, became a nurse? I know that's right. You didn't answer you didn't answer, Kev. It's not fair. Bella, I didn't see what you said, so it probably blocked you again. NY nurse don't want RN with, NY hospitals don't want RNs with only associate's degrees. It's kind of funny for any hospital to tell me, or to tell any associate's degree nurse what they want when they are fucking short staffed. And there's no difference between an ADN nurse versus a BSN nurse, except for, okay, the classes. But when it comes to doing the actual job, there's nothing that's different. Oh, and they pay you maybe $1 more. The only reason they don't want ADN nurses is because it messes up them trying to get magnet status, aka more money that they're trying to get into that hospital. That's what that means. But hey, for them to say that we're short staffed, for fucking people trying to be beggars being choosers, don't make sense to me. It don't make sense to me. All right. I had 4 clinical classes, became a master MP. Then I became disabled. Okay. Being accountable is the biggest thing as a nurse. Facts. It truly is. Right. Ask Redonda Vaught. I'm just letting y'all know. If y'all don't know her story, y'all better look it up. Don't give up. I passed on my 4th attempt. LP in here. Content. Y'all is Kentucky Boy Mom. That has to be Kentucky. I think that's Kentucky Boy Mom. Yo, she comes here all the time, y'all. And she passed on her 4th attempt. And no one is going to care. They're not going to be like, hey, girl, how many times you take that exam? They don't fucking care. Okay. If y'all find value, give me the 60,000 likes. Make it happen. All right. So case studies and SATA are partial credit. No, select all that applies are partial credit. All right. And then they have like if you do the closed questions or the fill in the blanks, those are not. Multiple choice are not. Select all that apply are. Go for your associates, then get your employer to pay for you to BSN. Yep. You can do that too. Hey, also think about relocating. Think about leaving. Like, if you have a place that's like, hey, we don't take for them to say they don't take ADN nurses, but they have ADN programs in a city that you live in, is just wild to me. Why even offer the program, right? However, I can transfer my job. Yep, you sure can. Kevin, I love your BS attitude or your no. Hey, look, I'm trying to tell you, please be a teacher. You're so made. I've been a teacher and I've applied at institutions of higher learning, but I don't get nothing. I don't get no response back. So I teach here. This is what I do. Right. Thank you. Understand exactly. Is a BSN worth it? A BSN is worth it. A BSN is worth it. if you plan on staying there, if you plan on staying as a BSN. But you can get into a master's degree program with an associate's degree in nursing. You can get, you can get into those direct entry ones, right? But if you plan on, becoming an NP or if you want to get your master's, you got to take those steps, right? That's so true. Save that bag, get your ADN, then go back. Yep, that's right. I'm here. Kat, I got you. And yes, everything you said would be there, is there. Okay, cool. Got you. Oh, you're in, Kat. Okay, cool. I'm glad that you're in. You're speaking truth. ADN here, got a job right off, and it went back for my BSN. That's right. Me and Miss Barbara have had talks back and forth. Off to bed, early morning, good night all, and happy Thanksgiving. Kat, happy Thanksgiving to you as well. Someone will hire you with an ADN. You are a nurse. Yeah, your degree of being a nurse is no different from a degree. Having an ADN is no different from having a BSN, except for the level of school. You just get more education in areas that you didn't get as an associate's degree. But the tasks of doing things as a nurse are still the same. They are. Bella, I'm not seeing your question, so I don't know what the hell you are talking about. Sorry to hear that. I need someone to kick my ass every now. Look, I'm just letting you know. Hey, I'm that dude. I'm a very, very assertive type of dude. I know when to back off because I can I read vibes, but it's just some people just need that. You need for me to be like, hey, you come here. Let's make it happen. Come on, stop playing games with me. If you get an ADN and pass the NCLEX, then you go for your BSN. Do you need? No, you don't. It's the same exam. Mike, I've told you that before. We've talked about that, sir. The same NCLEX you take as an ADN is the same NCLEX that a BSN takes. So once you take it as an ADN, you only take it once. Because your ADN is a degree. Your RN is your license. Two different things. I'm in LPN school right now. The thing that really upsets me is how hospitals were kicking LPNs out. And then COVID happened and they're just like, oh my God, please come back to us. That's a level of disrespect that I don't tolerate. So but hey, if you need to go out there and make your money and get your job, who am I? Who is Kevin to stop you? You know what I'm saying? Who is Kevin to stop you? Yeah, because you talk to me crazy all the time. Stop it. I did not see anything that you put in there. All right. Hey, real quick, if you guys are new here, welcome. We're talking NCLEX. We're talking nursing. My name's Kevin. I'm a nurse. I have my bachelor's degree, if anybody really cares. I'm going back to school to get my master's in education. So also, I created an NCLEX course. I was just talking about it earlier. Right now, it's $48. You get lifetime access to it. Lifetime. That means until you expire or whatever. I don't mean that in a disrespectful way because, we all expire at some time. You know what I'm saying? So, but yeah, for $48, y'all, $48. It says, how long is each lesson in the 7-day NCLEX review? Alex, each lesson is less than 30 minutes. You want to know why? Because I have taught formally, formal education in front of a classroom from anywhere from 25 to over 100 students. And let me tell you something right now, standing up there for an hour talking to people is exhausting. And I know it's exhausting for y'all to sit up there and not want to fall asleep. So I incorporated for each lesson to be less than an hour. Even if the lesson is an hour and a half long, I will break each video to be around 30 minutes. You see what I'm saying? And as a matter of fact, anybody that's in here who's gotten the review can attest to that. There's one video that's in there, though. I think it's 33 minutes long, and I'm actually mad. So I guess I kind of lied, but it's right around 30 minutes. But the majority of them, except for that one, is less than 30 minutes, okay? It says, I'm in an MSN nurse educator track right now, plans to pursue PhD in 2025. Shout out to you, Audrey. I don't know if I want to go for my PhD. I've just gotten so kind of fed up with school, but, y'all tell me all the time. I get people that DM me saying you need to go get your PhD. And I'm just like, damn, dog. It's like talking to my dad. So ADN versus BSN are both RNs. Yes, ma'am, they are. Why don't the ASN nurses sue that hospital for discrimination? That's a good question. Thank you so much, Kevin, for these lives. Motivation, shooting straight. Look, ma'am, you already know this is the life that I'm about. You already know this is the life that I'm about. Alex, you are very welcome. I don't know if you're a male or a female, so I'm not going to call you sir or ma'am. So I'll just call you Alex. All right. It says pink, same classes, except BSN is more management and research. Facts. It sure is. And there's also research. Oh, I already said research. So they talk about definitely management and definitely research. 2 years versus 4 years, more clinical time, really. Well, I mean, it took me 1.5 years for me to get my bachelor's. However, I was in an accelerated BSN program and I had did all of my prerequisites before I had got into my RN program. It's just more writing and time, and hopefully you can get that PhD paid for by. So I'm in the military, so all that getting paid for regardless. So I actually used part of my Montgomery GI Bill to get my bachelor's, and I still have 18 months left on my GI Bill. So, all right, Alex, I see you, sir. I appreciate you. So my GI Bill is going to pay for the rest of it. All right. But hey, if you guys are finding value, you know what I'm saying? Make sure you guys smash that like button. Make sure you guys give me a follow. Also, let me tell you, let's talk about accountability, right? I'll tell you why I failed the NCLEX multiple times. I thought I knew what I knew when I didn't know not a damn thing, right? It says, do you have a certain length of time to take the NCLEX? You have 5 hours. I actually have a video inside of my course that talks about that. But you get 5 hours to take the NCLEX, and you have a minimum of 85 with 150 as a maximum. Okay. It says, it seems like we do more papers and leadership work. Yeah, you do, for sure. But yeah, let's talk about accountability, right? I wasn't accountable because I just didn't know. Like when you study for NCLEX, you have people that are all in your face all the time telling you, you need to do this, you need to do that, you need to study, you need to do 75 questions. You don't want to take this exam again. But what if you have to take this exam again? They don't talk about that. And then when they do talk about it, they talk about it in such a fucking negative way that it makes you not even want to go and take it again. But I'm here to change that narrative for y'all. All right. What is the worst thing that could happen to you today? Think about that. If failing your exam is the worst thing that can happen to you today, I think that's okay. I would think that's okay, right? So now you're going to have some accountability when you go and you take it again. You have to think in utopia when with the NCLEX for sure, you have to think perfect world, everything perfect. You have everything, right? Accountable nurses are the best nurses. That's facts. You have to have accountability for what you do, but then also for what you don't do, right? Because if you don't, you could, let's say you were supposed to give that medication and you didn't. Or let's just say you gave that medication. Let's say you gave beta blockers with DIG, but you didn't check the patient's vital signs. You didn't do that. That holds you accountable because you're responsible for giving the meds. You see what I'm saying? So if you can't be accountable at the beginning before you become a nurse, that very well could trickle into you becoming a nurse. You know what I mean? So you have to have accountability. Your boy would be like, man, I don't know why I didn't fail. I don't know why I failed. Of course I knew why I failed. I came home, had my laptop in my lap. I wasn't on TikTok, but I was on Instagram, Instagramming, had the TV on, had a podcast on while I'm sitting here on my computer trying to read. And then I'm scrolling through Instagram and all kinds of other stuff. So of course I'm not going to fucking pass that exam. It says, good night. I'm going back to cooking. Happy Thanksgiving. Don't give up, y'all. Kevin, I didn't. I know that, ma'am. I know that's right. Happy Thanksgiving. All right. You have to be the nurse you want to be, taking care of you. Account of facts. As an LPN, would working in a clinic be good? Cassidy, it all just depends on you. It all just depends on you, right? It could be, right? A clinic is a job. You still have to utilize those nursing skills in case something happens. But working in a clinic is fine. It still involves some type of patient care, right? So, like I said, with accountability, you have to have it. I didn't have any. And it took me getting to my third try or to my fourth failure for me to get some, because I had a mentor who grabbed me, by the horn, so to speak, and was just like, hey, you're doing something wrong and you need to figure it the F out. And I was just like, you're right. And so he took me under his wing and he guided me in that direction, right? And this is why I do this, is to help guide y'all, right? It's not just about the course and it's not just about my coaching, but it's also to come on here and guide y'all, right? Like I would be doing a disservice if I didn't do something like this. You know what I mean? Because I truly enjoy being able to do this. Like those other things are just a byproduct of me wanting to give back to y'all. All right. Any tips for med-surg classes? Kevin, get into first of all, good name, because that's my name. But first thing I'll tell you, get into a group, small group, you and 3 other people. Split it up, 25% of the work. You do 25%, so on and so forth. Do 25%, reap 100% of the benefits, but find a good group. Thoughts on aesthetic and cosmetic nursing? Well, obviously, I don't got that problem. You know what I'm saying? So, but trust me, a lot of nurses do it. And there's nothing wrong with it. If that's your love and that's your passion, that's where you want to go make it happen. A level 1 trauma hospital is 1 hour away for me to commute in another state. Hey, that's a lot. But do you want to do it? I used to drive 45 minutes to work, and it wasn't a hospital. It was military work. So clinic work is fun. Business hours Usually the day usually moves pretty quick. Yeah, it does. Is it worth looking into working after school for the experience? Yes, 100%. 100%. But then it all just depends on, I'm one of those people is that you need to have short-term, long-term goals. 6 months, year, 3 years, 5 years, 10 years. So where do you want to be within the next 3 to 5 years? Do you want to be a nurse practitioner? What type of nurse practitioner do you want to be? You know, and if you do want to be a nurse practitioner, you need to put yourself in those positions that can get you there faster, aka the knowledge so you can get into a school. You know, I would love to be able to get my feet wet before I get into school job wise. Where do I start? So you can become a patient care. This is for Kelly. You can become a patient care tech. You become a patient care tech. You can start volunteering at the Red Cross in the hospitals because all hospitals have them. That's how you can get your exposure to where you want to work, right? Also, Kelly, just throwing it out there, and it's for everybody that's going to nursing school. I have an NCLEX course, and if you don't know what the NCLEX is, that is the licensing exam for both LPNs and RNs. It's going for $48 right now, and you get it for a lifetime. So a huge flex. I'm trying to tell you, anybody that's in here, a huge flex for you to have an NCLEX course, a licensing preparation course, for $48. And you'll see exactly what I'm talking about when you start nursing school. I thought about geriatrics. You could do that too. You can do long-term care facilities. You know, you can do that. There are so many things that can go wrong. So you need tons of education and mentorship. Facts. You sure do. You mentioned level 1 trauma is where to go. I did. I mentioned that because level 1 trauma facilities usually have everything that you need, aka most of the people, the doctors, the residents, the equipment. Level 1 trauma facilities are usually the ones that get the most money from the federal government because they're community hospitals. All right. That's why it says what nursing job is realistic for your life is important too. I can't do bedside. Anastasia, I can't do bedside anymore either. Like, I can't do it. I can't do it. Like, I've been deployed twice. Your boy got back problems now, and I can't even do it. I can't do it. I remember the first time I stepped on the floor and I was just like, oh, sweet, buttery Jesus. And I was like, yeah, I don't know how this is going to work. I fought through it and then, stuff happened and I was like, no, I can't do that no more. So it says, thank you. I didn't know about the Red Cross. Where can I find that? Kelly, you can go to any of the hospitals near your local hospitals, go to their website and then look for the American Red Cross. Super easy. I could never do level 1. Too much on the line for me. Yeah, that's true. However, for new nurses, I would recommend that. How does an externship work? So essentially, while you're in nursing school, you work essentially like as a patient care tech / soon to be RN under the guidance of under the license of a registered nurse, Nicole, right? And so essentially they'll have you start doing the tasks that you've essentially been checked off for, and you get paid for it. So you're essentially getting experience, even though it's kind of like clinicals, but you get paid for it, if that makes sense. It says, if I work in a hospital, I can't decide between outpatient psych or OB. Cassidy, I'm going to need for you to figure that out. Or guess what? You can literally work in every section if you want. And by working every section, you start at one and then start at another or start there. You know what I'm saying? So, but you can't work all three. Let me tell you something. The one thing you don't want to do as a nurse is burn yourself out. Trust and believe me. Such a teaching experience. Yes, a teaching experience at a trauma facility for sure. Anastasia, single mom life doesn't mesh with bedside hours. Facts, it does not. What do you suggest job-wise while in nursing school? My school only suggests 10 hours. Let me tell you, I worked full-time as active duty Navy, as a Navy instructor, teaching the whole time. So I worked 40-hour weeks all the time while I was in school. Now, that depends on you. Is it Sharia or Shara or Share? What, you know what I'm talking about. It all just depends on you. I worked a full thing and I had life going on just like everybody else. But, it depends on what you can do for yourself financially. I did an internship, and I swear that my internship is the reason I passed my NCLEX. Facts, because you keep it. It happens. You get the knowledge all the time. How accurate is the good pop up? The good pop up is, I want to say it's 99%. However, I have seen people get the good pop up and fail, and I've seen people get the bad pop up and pass. So do that at your own risk. I'm going into the ICU. Forgot to tell you, Kev. Oh, that's what's up, Bella. That's what's up. Now I can finally see what you put on there. Hey, but what's up? Hey, I finally got through all the questions. What's up? What's up? Hey, y'all, we do NCLEX questions. Very first thing, 5:30. All right. Will you recommend the NCLEX study guide that you offer to help me pass the HESI? You talking about mine? So I have an NCLEX course, Sarah, and if you go to the link in my bio right now, it's for $48. Okay, it's $48. I have a new generation NCLEX review in there. It's 8 videos. Each video is less than 30 minutes. And we go over questions, answers, rationales, the topics of the question, and what to look for. Okay, I've gotten a lot of great feedback off of it, and it's really helping people. Okay, so you can go, and I'm telling you, it's for $48. So you can go over there and check that out. Also, Barbara says, I work full time. Also, I had a small child and a husband. You can make it. It's accountability. Facts. What people failed with the good pop-up. Now I'm scared. Don't be scared. If you, what is that? Lena, you're the best. You the best. It says what people, there's tons of people. You are an alpha wolf. Look, I don't be playing these games. Brooklyn, really? But, yeah, because the pop-ups, those are glitches in the system. They're not official. So, I mean, you do them at your own risk. I have had people come to me and say, hey, I did what you said in the videos and I got the bad pop-up and I passed. And I was like, good for you. I flat out say in the video, do it at your own risk. Or I had people say, hey, I got the good pop-up and I failed. And I went through your video and I was just like, okay, I'm sorry to hear that. I told you, do it at your own risk. I told you it's not official. So that's the risk that you run. Because I did it the first time and I got the bad pop-up. I'm sorry, I did it the first time and I got the good pop-up and I failed. So I'm I'm a person that can tell you that, right? Navy vet, yeoman life, gross. I'm using my VRE to pay for my school, so I'll probably keep it chilled job-wise. Hey, shout out to you. I'm using my GI Bill, but once my GI Bill finishes, I'll probably use the VRE for me to get my doctorate, all right? Anastasia says, be realistic with yourself and you personally can handle the school and the work-life balance. Facts. It says, Emmeline says, I did the Pearson View trick and passed. It works for me. Thank God. Hey, like I said, it's unofficial. It's a glitch in the system. If it works for you, cool. If it doesn't, it doesn't. My only official way is when you go to your board of nursing and you find your license and your license number with your name, right? That's what I did. That's what that's what I did on my 4th time. I was like, I'm not doing no Pearson View trick. I'm not doing that shit. I honestly almost forgot about it until I got the email saying, hey, your results are ready. And I'm just like, bet. So I went straight to where I went and I saw it right there on the board of nursing. So that could be the very same thing for you. Audrey, it says, yeah, I had to go for full-time to part-time for my MSN program. I was getting burnt out. Yeah, it'll do that to you for sure. Anastasia says, also depends on the job you're doing while going to school. 12-hour shifts plus school ain't it. You're right. I've seen nurses do 12-hour shifts that worked on med-surg, and they worked nights when not shit was going on, and they were doing all their schoolwork there. And I'm just like, look, okay? So just got your course. I hope I can pass on my 3rd attempt. Ray, I really think that it'll be helpful for you. However, you got to think to yourself, you have failed. And by the way, we're very open out here. Like, we don't shut people down on all the. I failed 3 times and I passed on my 4th. So you got to really think to yourself, Ray, can the course help? Absolutely, right? But then you also have to think to yourself, what is it that you aren't understanding, right? Think about your time management, your accountability, right? Also, are you getting enough content? Hey, did you look at your breakdown? Did you look at your performance sheet? You know, like, what about your support system? What are you not understanding? Do you not understand the questions? Did you not read your rationales? Did you take notes? That's why I do them in the video content. That way you guys can visually see what I'm talking about. Also, you get downloadables. And by downloadables, every PowerPoint that I go through, I put the PowerPoint inside it so you can download it for yourself. You know what I mean? What's up, Camille? You need above passing in each category. Incorrect, Cassidy. You need to have an accumulation of it being above the passing line. That's what you need. You literally could be above passing in like 3 categories, but be near passing or below passing in 4 categories, but still pass. As long as it keeps you above the passing line. Okay? I've heard different. Well, I'm telling you that ain't it. You don't get above passing in everything, but above passing will definitely make sure that you pass. You literally could get below passing in 1 section and still pass. You know what I mean? I'm just keeping it real. I'm letting you know I'm nervous to take it again. Nah, don't be nervous. Above passing in the harder topics. So you have three big topics. pharmacology, management of care, physiological adaptation. Those three sections make up 44 to 49% of the entire exam. It says, I've also heard you only get above in 3 categories. Though those would be the categories, right? But remember, there are 8 client needs, right? So what if you're not doing so hot in pharmacology, but you fucking wreck, management of care, but then you do really well in psychosocial integrity? You know what I mean? So it is a balance game. It is very much a balance game. Okay. So if the passing line is here, you need to be above it. And they give you different categories. They give you different questions from different categories. Now, if you start getting questions wrong, this is where you end up. And when you see stuff that's near passing, this is you. Up or up, down, up, down, up. That means you're teetering the line. Okay. NCLEX is testing if you know enough to keep patients safe. That's exactly what it does. You're not supposed to be an expert at this exam. They're going to start throwing stuff at you that you don't even know. And if you start getting questions like that, that's how you know that you're doing pretty well on that exam. You know what I mean? So that's how you have to think of it. That's how you have to think about it. There was shit on there I didn't know. Look, they actually threw something about Wolff-Parkinson-White syndrome for mine. And I was just like, bro, I've heard of that. I have never seen what that EKG looks like. Never. And even when I did an EKG class, I didn't see it. I was like, what in the actual hell is this? You know what I'm saying? So, that's just how it is. I failed in 150. Wait, hold on. It says I failed in 150. Is that what that means? I was on the line the whole time. I don't know. Is it Chiquita? Are you telling me that you failed? Or are you asking for the fact that you got to 150 questions if you failed? Camille says how to keep going if your test doesn't shut off at 85. How to keep going? Honestly, this is where the practice comes in. You should be doing at least 85 practice questions, but no more than 150. Right? So do 85 questions, turn around, and then do another, 45? No, I think I did it right. 8, 9, 10, 11, 12, 13, 14, 15. So like 60, right? So you need to do a total of 150 questions. If you practice going the distance, when you get to question 86, it's not going to be new for you. You're going to be like, cool, I'm still in the game. I'm still doing this. I practice for this. Let's keep going. All right. Well, I just had a Wolff-Parkinson-White syndrome patient. Look, that's crazy. I failed 2 times. I failed 3. Stamina. Yes, you have to develop the endurance of sitting in front of this computer and doing more than 85 questions. You have to. Right? Because the moment that you get to question 86, if you've only been practicing 85, you're going to be like, because they always stress, you only want to get 85 questions. That's it. Blah, 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 blah. But the moment you get to 86, you're like, eyes get all big and you start freaking the fuck out. Right? So the way to alleviate the freak out is to practice going the distance every single time you practice. That's what I did every single time. And this is when I took the exam. It was 75 to 265 questions. Do you do one-on-one tutoring? Camille, I do one-on-one tutoring. That link is in my bio, right? You'll go to my bio. You'll see 7-day NCLEX course, which is $48. And then you'll see my one-on-one coaching. It'll take you to a link. It'll take you to the website, fill out the information. And then you'll see the course and it'll break down everything. You get one-on-one personal sessions. We break down NCLEX style questions together. You get my phone number. We do mentorship. You get unlimited motivation. So think about it like this. What I do with this, but you get that personally with me, right? And then you get a tracker, you get a calendar, you get a study plan, right? So we figure out where you need to start and we figure out where your quizzes are going to be. We develop trends. We figured that out, all that good jazz. My UWorld level was 65. That's actually really good. At 65, if you're scoring anything close to 50, you need to keep practicing, right? But if you're above 60, that's a high chance of passing. How many times did you take the NCLEX? I took it 3 times and I passed it on the 4th. I've passed it I got my license June 5th of 2020. June 5th of 2020. All right. So I understand every aspect of what you feel, right? And still failed? What you mean? Oh, you got a 65% with UWorld and you still failed. Look, I used UWorld my first two times. The first time I was scoring like in the mid 50s to 60s. Second time I scored in the high 60s and 70s, and I still failed with UWorld. I'm not a fan of UWorld. However, my thought process going into that program was there was still accountability and time management issues, but it was a lot better from the first time, right? So it all depends. Camille says, UWorld or Archer, I can't decide. I personally like Archer. That's me. That's me though. I like Archer. I like their program. I know how to navigate through it, all that sort of stuff. What's up, Tatted Mom? How are you? What's up? What's up? Hey, you already know you late. You late. We done already did the questions. We done already did all that. Hey, I had 101.7 thousand likes yesterday, y'all. That's the most, right? What are those? What are what? What are those? What are what? What do you mean? Jen, are you asking like what is UWorld and what is Archer? They're NCLEX prep courses, kind of like mine, but they give they also have content, and they also have NCLEX style questions, right? Mine right now only has content, but your boy is working on getting questions inside of there. Had to get 5 days worth of surgeries crammed into 3. What does that even mean? What does that even mean? All right. Hey, but shout out to everybody. Chelsea, thank you for the follow. I appreciate you. Hey, Kev, how do we find your program? So anybody looking for, yeah, that's right. You did say search tech. So anybody looking for the 7-day NCLEX course, go to the link in my bio up here, right? Tap on my face, my name, whatever. I did ask how you were. I did. So 7-day NCLEX course is the first tab. Once you click that tab, it'll take you to this website. I will show you what the website looks like right now. Give me 2 shakes of a lamb's tail? Do people really still say that? Don't matter. I said it anyway. So you guys are going to see what the course looks like right here. Okay. This is the website, right? You miss coming here, or I'm missing coming here. Karam, you can still come here and nerd out with us when we do stuff. I don't exclude you. You ain't got no 600 yet. So here's the special right here, right? It's good until tomorrow, right now. 7-day NCLEX course, y'all. It is unlimited, online, and it's on demand right here for $48, y'all. $48. $48. And yes, you get lifetime access. You get lifetime access. Baby's good, Camille. You know him. He out here running the house. Tad said, I inboxed you and you never responded. I'm sorry. Wait, did you? I don't think I ever got a inbox me again. We get access forever. Yes, you get access to it forever and all of the updates that I have going on. The price is going up from $48 to $97. Why is it such a huge discount? Because this is the pre-launch. I just started this program at the end of June. Right now, I have over 200 people that are in this program. It's such a steep discount because I want y'all to know that I'm about this. Legit. I want to purchase it for my daughter. Buy it. Purchase it right now. I'm literally showing you what it looks like right now. All right. It says you did and you responded, but I never said anything back. Yeah, that's mean. I'm gonna need for you to respond to me, ma'am. Okay. Do you have reviews? Camille, I'm glad that you asked. So this is what the page looks like. All right. This is what the inside of the review looks like. Okay. So right now in production is my 7-day review where I go through management of care, farm, physiological adaptation, health promotions and maintenance. I go through psychosocial. I go through basic care and comfort, safety and infection. I go through all of it, right? And right here, we talk about here's the content, right? But what's in there right now, which is the bread and butter, is the review for the new generation NCLEX. All right. Anastasia says, Kev, what are your credentials and background? I've been a nurse for 3.5 years. My credentials, I've taken this exam multiple times. But I've been a nurse. I'm a nurse. I'm an RN. I have my bachelor's. I've been a nurse for 3.5 years. I'm a master instructor. So I know how to set up curriculum, write it, and actually put it out. I've worked in the ICU. I worked in a burn, a neuro, and a medical ICU. I've also worked in a PACU, and I currently work as a OR nurse. All right. So there's my credentials. I'm a nurse. I'm a nurse teaching other nurses how to do something that I failed at tremendously. Right. Like reviews from people who have. So I actually have right here. I have testimonies right here. There's testimonies right there. There's testimonies down here from the website as well. There's me when I worked at the burn center right? And then there's testimonies right here. So I did coaching, and the coaching is essentially the on-demand aspect of the course, right? So I have other testimonies. Also, I have other testimonies that I'm going to be loading up in here because I'm going to be updating my website as well. Okay. So, but hopefully that answered you guys' question. Does one need college degree to take the NCLEX? Is it Trisha? You have to go through an accredited college or accredited program in order for you to take the nursing exam. Yes, you do have to have that. Okay. Y'all can look up this man, his license online too, if you don't believe him. Facts. You guys can look my name up for the Texas Board of Nursing. I'm in there, legit. Because being a nurse, you have to have a license, and it is part of public record, right? So, like I said, here we got the NCLEX review. Check that out. So with this NCLEX review, I'm on the first one. At the beginning, you guys see my nice little logo. We talk about the intro. We talk about what's new on the course. We talk about the NCLEX test plan structure, the length of the exam, and then we jump right into questions. I talk about the topics of the question. You talk about what to look for, what the question is asking you. We go through the answers, right? And when I put this X, I tell you why it's wrong. We talk about why it's wrong, and then we talk about why it's right. And then we go through it. We go through a bunch of, I go through 100 questions. I go through 100 questions. And yes, there are new generation NCLEX type of questions that are on here, AKA case studies. Kev, do you wish you had your own program I do. And that's the reason why I made it, though, is because there are people that are out there that feel like, man, like, why can't I get through it? Look, I will tell you my story. It says, just dropped my phone and on my sleeping toddler time. Ma'am, why did you do that? Oh, my goodness. Yeah, you about to be up. That toddler about to be mad at you. But all right. Hey, so Anastasia, I appreciate you being here rocking with us tonight. I really do. So, yeah. Hey, so with the course, you get the we go through case studies. There's multiple case studies in here. Right. And then also I have bow tie, like the different types. We do bow tie for the case studies as well, because you guys will see stuff that's like that. OK, we go through a whole bunch of them. I think this is one bow tie. Nope. Here, I'll show you guys what the bow tie looks like. Nap trapped. Yeah, you are. Oh, yeah. I've been there. Right. So check this out. Different type of question. Right. Bow tie type of question. Thanks for your support on our future coworkers. This is why I do it. I appreciate you being here. So, hey, also let your friends know about me. Everybody that's in school, come get this course before it goes up to $97. Okay. Hey, but yeah, so you get these type of questions. Also, there's content videos in here right now, y'all. I have 18 pharmacology content videos in here, right? Look, diuretics, IV fluids, cardiovascular meds. We talk about central venous access devices, blood and blood components. We talk about, I got Pharm 1, 2, and 3 in regards to freaking cardiovascular meds, antibiotics. We talk about fluid electrolyte imbalances, cardiology, which is in production right now. Also, we talk about the endocrinology, talk about diabetes, talk about freaking Cushing's, Addison's, all that good jazz. Sorry if you guys can't see it. It's blocked by the bar right there. All right. So that's the stuff that you guys get. If you guys are looking for it, that link is in my bio right here. And it's $48, y'all. Look, $48. $48. And yes, you get it for a lifetime. Hell, even if you wanted to buy it for somebody that you knew as a Christmas gift, why not? Best $48 you would have spent on them. OK, best $48. All right. Hey, but shout out to y'all. All right. Hey, it's already 8 o'clock. You guys already know what the deal is. So your boy is about to log off because, there was some food that was made and your boy's hungry. You know what I'm saying? So I won't be doing a live tomorrow because it's Thanksgiving. However, I will be dropping videos throughout the day to remind y'all that this bonus is going away. It says OG. It says, wow, want to get through. I am not a nurse. What you mean, Joanna? I don't even understand what that, like, you speaking to me in a different language. But, okay. But yeah, so I won't be doing a live tomorrow, but I'll be dropping videos tomorrow just to make sure, like, hey, go over there and get it. It's going to end. I'm going to put a timer on it and everything, y'all. Okay. So I hope everybody has a wonderful Thanksgiving. Give thanks Hey, here's some perspective for all 86 of y'all that are in here still rocking with me. You guys could be in a different part of the world right now dealing with conflicts. You know what I'm saying? But you're blessed to be, regardless of whatever's going on, you're blessed to be in a place where you don't have to deal with that. You know what I mean? So definitely give thanks to where you are in life. Definitely give thanks to the positions that you have, and definitely give positions on where you live. Give thanks to the position of where you live. Trust me, I've been on 2 deployments and I've seen how people live, and I'm very fortunate and blessed to be in the position of where I live. I can tell you that right now. I want to buy it, but I'm not a nurse. Joanna, buy it for somebody for Christmas. Just saying. But no, I got you, Joanna. You're not a nurse. It wouldn't be beneficial for you. However, it might be beneficial for somebody. So if you know somebody who's in school to be a nurse, hey, drop it. Or, drop the link in your Facebook or whatever. Hey, however it's shared or put out to people, like, I'm okay. I'm cool with that. All right. So like I said, you guys have a wonderful Thanksgiving. Hope everybody is safe. You guys definitely be safe. If you guys are going to be deep frying stuff, you know what I'm saying? Just be careful, or get an oilless deep fryer like your boy because he's clumsy. So, like I said, hope everybody has a good Thanksgiving. Take care of yourselves, and I will see everybody on Friday.